wanted to take the opportunity, first of all, welcome everybody. It's good to see folks here and folks that are coming to speak to us today outside with a spirit that wants to connect with us in a positive way. I certainly am hoping for that. And also wanted to say thank you for your patience. We are now technologically connected. We can actually conduct the business of the residents of Pinellas County. And now to be spiritually connected, Pastor Randall Morris from the Gulf Coast Church of Largo will come up and lead us in invocation, and then Commissioner Seal will lead us in the pledge. Thank you. Good morning.
Father, we pause to thank you for your kindness, your love, and your mercy to us. Lord, it's because of your compassions, Lord, that never fail, Lord, that we are blessed. And great is your faithfulness. God, we honor you today, Lord. As I come to you, Father, I pray first of all a prayer of thanksgiving to thank you for the opportunity to live here in Pinellas County. God, what a blessing. God, what a blessing. And for me personally, my family that goes back to the middle 1800s, Lord, that have been around here. And so, God, thank you for the generations that have brought about blessing over each one of us here. And Father, I pause to again thank you as well for all of our commissioners. Lord, thank you for our chair, Lord, and all of the members here. And I pray, God, today blessing and peace over them, over their families, over their businesses, Lord, over everything that concerns them, God. We, according to Scripture, Lord, we're commanded to pray for those, Lord, that lead us. And so, God, we pray blessing over each one. And, Lord, we pray blessing over the citizens of our county, Lord. God, we pause to especially pray for those that are being so adversely impacted by this dread disease in this pandemic. And, Lord, we pray for an eradication of this sickness, Lord, and this disease. God, I pray, give wisdom to everyone in the medical community and wisdom to all of us, Lord, to do what we can to see this gone. And I pray, God, comfort and peace over those who have lost loved ones. I pray strengthen and be with them, I ask. And Lord, we pray for those that are struggling and battling even right now as we come together with our healthy bodies, Lord. And we pray, God, for your healing touch over them. And now finally, Father, I pray for the wisdom that comes from heaven to rest on each one of our commissioners. Lord, that they don't just hear, and I know that they're here to hear the citizens, but I pray, Lord, that as well, that they will hear the divine instruction that comes from heaven, and that with your grace, God, you'll guide them and direct them, Lord, to bring about peace and righteousness here in our community, Lord, so that we can honor you, Lord, and continue to receive from your blessing. And Father, we pray and we ask this all in the name of the one who taught us to pray. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses as we forgive those who trespass against us. Lead us not into temptation, but deliver us from evil. For thine is the kingdom and the power and the glory forever. Amen.
Amen. Thank you. Thank you, Pastor.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you, Pastor Morris. All right, we have a Purple Heart Day proclamation. I think it's extremely appropriate that we do this today, even though August 7th, which was Saturday, was the actual Purple Heart Day. I spoke to the folks that will be coming up here, it was really important to them that we send a message to our residents that we don't forget this day as well. So I'm going to ask Mal Klingen. He's the commander of the Military Order of the Purple Heart, Dunedin Chapter JFK 1963, as well as Mark Brill, Patrick Kennedy, Rich Welts, Chaplain Beach, and Father Swick to come on up. Good morning. Good morning. Good morning.
Morning, sir.
Good to see you. Let's spread this way, guys. I don't know who's going to speak, but yeah, right there, facing that way. All right. These gentlemen obviously each have their own story, as the folks that they represent have their story. Proud heroes in our country, and I salute them all. And I'm so blessed that they're here this morning to talk a little bit about their mission as the Military Order of the Purple Heart. Got to see them each on Saturday at Dunedin's Purple Heart Day proclamation. It's a little cooler this morning. We all sweated to death and it was a long one too, about an hour. We'll be a little bit shorter today. So in any event, let me go ahead and read this proclamation, and then I'll have you all come up and speak, okay? We'll take a picture before that. The Purple Heart is the oldest military decoration still in present use, and was initially created by George Washington in 1782 as the badge of the military merit, and the Purple Heart was the first American Service Award made available to the common soldier and is awarded to any member of the United States Armed Services wounded or killed in combat with a declared enemy of the United States. And the mission of the Military Order of the Purple Heart, chartered by an act of Congress, is to foster an environment of goodwill towards the combat wounded veteran members and their families, to promote patriotism, to support related legislative initiatives, and most importantly, to make sure we never forget the sacrifices made by those so decorated. And there have been many Pinellas County residents who made the ultimate sacrifice in giving their lives in the cause of freedom. And there are numerous combat wounded veterans who currently reside in the county and as Purple Heart awardees contribute to their community in countless ways. Now, therefore, be it proclaimed by the Pinellas County Board of County Commissioners that August 10th, 2021, be recognized as Purple Heart Day here in Pinellas County. So, I do have a couple of proclamations, so I'll let you hold one. Mark, you hold the other. We'll stand right here in a row, and we're going to take pictures. Here's the camera person ahead of us. One more comment. And I did want to add one additional comment. We talked about the injuries that people have had serving. There's also a great number of folks that have suffered mental illness that is from these battles around the world that are kind of hidden in a way until they sprout in some unfortunate manner. So we're still battling that suicide rate that's unacceptable in our country, and we're certainly battling that among our veterans. We used to talk about 22 suicides. I think it's gone down to, what, 21? So we've made a one-person improvement, but we got a long way to go and a lot of work to do. And I know that the work that this county is starting on is going to be a big help in partnering with the VA and doing the work that we need to do to help your comrades and our residents that have done so well for us. So the microphone is yours, Mal.
Thank you. Although the chairman just said about everything I was going to say. But thank you, Chairman. Thank you, commissioners. Special thanks to Zachary Mims for everything that he does for veterans. Freedom is not free, as the chairman just pointed out. It's paid for by the men and women that serve in the armed forces of the United States of America. Sadly, some of them never return. Some return with visible wounds, some with invisible. But your leadership in Pinellas County has always welcomed them home and taken care of them, and we appreciate that. And thank you for your special recognition for those of us who have received the Purple Heart. Thank you.
Mr. Chairman, Commissioners. What's that? Oh, carry on. Good morning. It's an honor to be here again, and we thank you for the recognition that you're giving us, that you're giving the veterans community. You know, we're a pretty large community, or a very silent community, but we have a good leadership under Zephyr Mims and the Veterans Service Office in the county, and they represent, from statistics by the Federal Department of Veterans Affairs, over 84,000 veterans right here in Pinellas County. We are the third largest populated veteran county in the entire state. Hillsborough is number 1 and Dade is number 2. And the value that it comes from these silent group of people that represent 20% of our households is recognized in the amount of benefits that they've earned that are federally distributed to each and every one of us that have earned them annually. And that represents over $440 million into our county every year. This year alone, this past fiscal year, $440+ million. We ask that the veteran community be recognized, and we want to be of support to our entire community, and we look forward to being in partnership with you as we continue on. It's a pleasure to meet Renee. Thank you. Thank you for your service, and everyone, it's so good to see you all again, and thank you again.
Hi, I'm Patrick Kennedy. I just want to say thank you. We really do appreciate your support and your recognition from all us veterans. Thank you.
All right, thank you, gentlemen.
Thank you, sir. It's great. Appreciate it.
Blessed day. To thank Zephyr for his leadership and help and making good communication on a constant basis with our veterans, and his involvement with the Community Veterans Engagement Board down at the VA. He and I have both been honored to be on that group, and we have a direct line to the VA and to the issues that are going on that our veterans are facing. It's a good relationship, but we also ask the tough questions that need to be asked in defense of these men and their comrades. So I wanted to say thank you for that. And I also wanted to thank this commission for their leadership in creating a Purple Heart County here in Pinellas County. It joined many cities that have done that over the years, and all the way back to 2006 or 7 when the city of Dunedin did it. And I really thank you all for that perspective. So anyway, great to have you gentlemen here today, and you all have a wonderful day. And not to take too much time there, but I really appreciated the moments that we had. Our second person that's going to come up is also somebody very important to us in our community, and that's Steve Cleveland. He is the Chief Executive Officer from the Florida Dream Center. He's going to talk to us a little bit about the Dream Center. He's got a really called a partner presentation, and we're glad that he's here, right up there. Welcome, Steve. It's great to have you here.
Good morning, everybody.
Good morning.
Thank you for having me here today. It's been a few months since we've last talked about some progress that the Florida Dream Center has made. We all know, well, at least you guys do know what the Florida Dream Center does, but I wanted to bring you some data today. And if I do this right, let's see. Okay, so we have several programs. We have case management, our mobile food bank, our Adopt a Block program, our work readiness training, our enterprise, social enterprise program that we just started, and our volunteers and AmeriCorps through Vista. And we're going to talk just briefly about each one, and then we're going to get into some data. Okay, so in June of 2020, you can see we helped one person get a house. 0 for identification, 0 for mail, 18 government apps, health insurance was 2, and this is helping people in the community. Then in December of 2020, you can see that 18 people we helped get housing, 63 people got identification. We did 98 government apps, 29 people got health insurance, 9 referrals for, it could be mental health, it could be anything, and then we did 4 for legal. Now here we are, we're in August, but this is June of 2021. We've helped 124 people get housing, 165 people get identification, and we had to buy a bigger mailbox because we get a ton of mail every day because people that live in the Lemon area, there's no post office. So we get their mail, and we have, in June, 359 people are getting their mail from us or at our location. Government apps, 237, health insurance, 105, and referrals, 71, and legal, 102. So we are trying to help those in the community that have no other place to go. And I'm thinking that, we're going to have a big increase between now and December. So our mobile food bank in 2020 of June, we had 13 suppliers, and then we distributed 521 pounds of food, and then and when I say suppliers, that's who we're giving the food out to, other food banks, other community centers that don't have the ability to go get the food that like we are able to get with our partnership with Feeding Tampa Bay. So December of 2020, 28 suppliers that we supplied food to, and in June of 2021, we have 33 that we're supplying different food banks and community centers so that they can get the food out to the community. In December of 2020, we distributed 1.5 million pounds of food, and in June, we're at 601,000, and that is going to rapidly increase because of the holiday seasons and everything else that's going on. In Thanksgiving and Christmas, we'll feed a total of 2,500 families with turkeys and all the fixings. And so that's going to drastically add the rates up, plus the need for if we have some situations that come up with hurricanes or whatever, we can get canned food and emergency supply food also. Our Adopt-A-Block program, which we started November 1st, 2014, and here we are in August of 2021, still going strong. In June, we cleaned 50 alleys. December, we cleaned 170 alleys. And to date, in June, we cleaned 26. And that number dropped a little bit because of COVID. I mean, we were having a hard time getting volunteers to come, but now the volunteers are coming back, and they're picking up. The churches are coming back. The schools are coming back. Community service kids and men and women are coming back. So it's picking up. You can see that in 2020, we picked up and disposed of 43.5 tons of debris. In December of 2020, the total was 83 tons. And here it is in June 2021, we have 33.1 tons. The vouchers are people that come to us asking for help. It could be through code violations. It could be needing their yard mowed or any other things. So those are the numbers that we have for that. And this is a new program that we started about 3 years ago, our workforce readiness training. In June of 2020, we had 6 people, and 6 did forklift, and they got 6 certifications. And that certification is through the state of Florida, and it's good for 3 years. In December of 2020, we had 14 forklift, 13 certificates. Now, things changed just recently. We are involved with a workforce training program that does carpentry and core training. And that actually was being done at P-TECH a while back, and P-TECH lost their 2 master trainers. And we were approached and to see if the Florida Dream Center would be willing to become master trainers, and we did. So, so far we've had 53, and that is through the NCCER certification program, which is accredited by the University of Florida. Core construction, we had 31 that took the class and passed. Carpentry level 1, 31, forklift 22, and 41 graduates. Something I want to add to this real quickly, it's not on your PowerPoint here, that through our workforce training program, we're able to help people in the community. If we find a good student that we think that we could hire, we've been trying to figure out how to do that. So a couple weeks ago, we got the AARP Senior Citizen Grant to help 50 senior citizens, which is going to help us put some people to work. But the big thing is, Friday, we were told that we were one of 3 people in the state of Florida that won the HUD grant. So the HUD grant consists of keeping seniors in their home, and it's $1 million. And that's going to be able to allow us to hire 8 people, and that money is going to go right back into Pinellas County to help our citizens with up to $5,000 per house to help them stay in their homes with repairs so they can live a safe life. And that's through our workforce training program. Social enterprise, which I briefly mentioned. You know, a while back, my staff would come to me and say, you know, we're running short on grants. And, you know, they're not out there, blah, blah, blah. Well, I can't sell widgets. I mean, we just don't do that as a nonprofit. Well, a gentleman came to me and said he wanted to give away his T-shirt factory company, and we took it. And so now we're making T-shirts, embroideries, hats, T-shirts, and we got a good waiting list to get them, as some people know. So that way we are, and also that's through our workforce training program also. So we have apprentices that come in and can work for 10 to 12 weeks or 6 to 12 weeks, and then help them get a job and move forward if they want to do that, you know, in another part of their life. Volunteers, like I said, the numbers are down, but they're starting to come back. I mean, you know, before the pandemic, I mean, we had close to 6,500 volunteers every year, but they're growing, they're coming back. So we're very pleased to see the number of groups that are coming every week now. Okay, so we mentioned briefly AmeriCorps Vista, if anybody's familiar with that. It's where we wrote a grant and we were able to get Vista employees, which actually work for Vista. It's a 2-year contract with the employee. Vista pays $14,000 a year, basically. And we are the only organization in our area that is matching that salary for a living allowance. So they're getting $28,000 a year. And we're like the only one that's doing it. And that's the Florida Dream Center. If anybody has any questions, if not, thank you very much.
Wow. Amazing the work you're doing. You and your army of folks that have really taken it upon yourself to change this community, well, only from the inside out. I mean, it really is amazing the number of tons of debris that you've removed, jobs, training people up for jobs. I think it's just amazing the work you're doing, and we couldn't be more blessed to have the partnership that we do with you.
Thank you so much, Commissioner. I mean, Mr. Chair, it's an honor to partner with you guys, each one of y'all, and I know just about every one of you, you know, and we hope to be here long time and keep spreading and growing. So Thank you again.
Commissioner Justice.
Thank you, Mr. Chairman. Yeah, and if you're going to get embroidery done there, don't make the mistake of dropping Steve's name, because I did that and I got put to the back of the line. You want to drop Zelda's name, and then you'll get moved up to the front a little bit. So that's an important tip for you. No, I was telling someone the other day about the Dream Center and the history in Lellman and how many other expansion that you've had, and thinking about how it started with that first Saturday of just kind of cleaning out an alley and knocking on some doors, to the expansion of services that you offer today, and always thinking all the way along the way, it was never about this grand vision to become this substantial organization that you are now, but every time it was, how do we meet that need? There's another need. We found another need. How do we meet that need? Another need. How do we meet that need? And just the work that you all do, it's inspiring to the rest of us. So just thank you very much.
Yeah.
I appreciate that. Thank you. But it's the volunteers and the staff and the hard working and the commitment that makes this happen.
Of course. Of course. Is anybody else? Yeah, Commissioner Long.
It's nice to see you standing here, Steve, and it sure is proof positive that God had a special mission for you several years ago. And it's amazing to see the progress that you've made from where we first started to where we are today. So thank you. You have certainly found your passion and your mission in life.
Thank you, Commissioner.
Amen. Anybody else? Okay, well, anyway, great to see you. Glad you look great, and thank you again for your leadership in Lellman.
Thank you guys so much. Have a blessed day.
Yeah, you too, my friend. Well, we got two really what I would consider very uplifting messages today. Steve, you and your group are just amazing. Mal, you and your team, of course, our hearts are with you, and our thanks are obviously always with our military folks, our veterans. Just, it's a great county, a great community that we have. And now we're going to turn to the folks that we represent, who are our residents who want to speak to us under citizen input. And
Commissioner, did you want to have Dr. Cho give a report first?
Yeah,
you
that's
had
probably a
requested
good
that
idea.
last Thursday.
Yeah, some of these citizens will probably want to respond anyway, so that's a good idea. We'll hear first from Barry and his team.
Commissioners, you asked for an update on some of the issues regarding the impact of COVID that's having on our healthcare system. So I've asked for Dr. Cho and Dr. Jameson to provide a brief update, and then I'll have a few closing remarks, and we can go from there. We can answer any of your questions. Dr. Cho?
Good morning. Can you hear me okay?
Yes, we can hear you fine.
Okay. Just to start off with some of the trends, unfortunately, we are seeing a significant increase of cases and hospitalization due to the more contagious Delta variant. Just to give you some of the trends, our 7-day case count is 100 cases per day, and our 7-day percent positivity is at 16.2%. Now, these are the highest numbers and cases throughout the pandemic. Generally, in terms of the most impacted age group, it's about 20 to 30-year-olds, 39-year-olds. In terms of our death rates, we have seen a slight increase over the last month. We have 40 reported in the last 2 weeks. Keep in mind that the death counts are delayed and is lags because it does require confirmation working with the ambulance.
Dr. Cho, yes.
You're away from the microphone. I don't think they can necessarily hear you clearly.
Yeah, I didn't hear the mortality information you were just giving, so you could start from there, please.
Okay, sure. In terms of our death count, 40 reported in the last 2 weeks. Keep in mind that there is a lag, so that may be delayed or further increase. Obviously, one of our biggest concerns is the hospitals and our healthcare systems, especially if this trend continues. These are the highest number of hospitalizations at any time in the pandemic. We did stand up the hospital working group, and we have multiple calls with hospitals over the past few weeks. What they're reporting is about 25 to 40% of the hospitalizations are COVID patients, and the beds are tight on their end. 27% are in the ICU. Of the ICU beds are COVID. Even in our Johns Hopkins All Children's Hospital, they reported this morning 12 hospitalized patients with 8 in the ICU. These are more on the higher end of the numbers they've seen throughout the pandemic. And obviously, the kids do well and don't usually require hospitalizations. They do testing pretty frequently in their ERs and their clinics. And to give you that context, in June, in their healthcare system, They diagnosed 12 pediatric patients. In July, it's 181. And thus far in August, it's been 90. We are also seeing a long wait times in emergency rooms, and I know it results in EMS bed delays. And I know Dr. Jameson can speak on that a little bit further. Some of the healthcare systems have canceled elective surgeries, as well as requesting vents and other supplies. What I also heard this morning is that we are now out of adult ECMO capacity in the Tampa Bay region. And what an ECMO is, it's a cardiopulmonary bypass for severely damaged lungs. So that is, there is no capacity for this at that time. Now, in terms of moving on to testing, we have seen an increase for the demand in testing over the last few weeks. We did close to 5,000 yesterday as a system. We continue to push the Pinellas County government site that lists all the testing sites that are available in the county. And in anticipation for the increased demand, especially with schools restarting, we did open a testing site at the Center for Health Equity. We did approximately 600 yesterday. We are exploring other locations at this time, as well as the ongoing demand. We've also had community partners, such as the community health centers in Pinellas step up as well, and we'll be opening testing sites for school staff as well as students. On the vaccine front, a little bit of good news. We have seen an increase in vaccine rates over the last 2 or 3 weeks. In mid-July, we were averaging about 46 to 4,500 individuals vaccinated per week. In the last 2 weeks, we've jumped up well over 10,000. Currently, of the vaccine eligible individuals, 12 plus, 65.3% of Pinellas residents have received at least one dose, and 57% have completed the series.
Dr. Cho, could you say those percentages again, please?
For 12 and up, 65.3% with one dose, at least one dose, and 57% have completed the series.
Okay, and did you say the 65 or the older age group yet? I'm sorry, did I?
Oh, in terms of 65, 86.1% at least with one dose, and 77.6% have completed the series. A good place to get that data, Commissioner, is the CDC data tracker. If you go to the county view, you can click on Pinellas County. It's actually giving more accurate numbers than even some of the state dashboards, because it incorporates the federal sites of the VA, something that we talked about earlier in these meetings. So I suggest you visit that website.
Thank you.
Obviously, vaccine is something that we'll continue to push. It's readily available. You can find a vaccine location at vaccine.gov. We have it in our DOH clinics, pharmacies, medical clinics throughout the county. From our standpoint, we continue to conduct outreaches. We did 7 last week, engaging employers, churches, other community events. We do encourage businesses as well as other partners to reach out to us, and we can partner with them for those outreaches. And then lastly, from me, as a public health official, as an infectious disease physician and a parent, I strongly encourage everyone to get vaccinated. If we ever want to see this perpetual cycle of COVID waves, and we all need to do our part and get vaccinated. So with that, I'll stop there, and I'll stop there.
And if we want, we'll have Dr. Jameson move
Yep.
to Dr. Jameson, and he can kind of give you what's occurring within our EMS and system, and him as an emergency room physician. Are you on the line, Dr. Jameson?
Yes, Barry, good morning. As Dr. Cho mentioned, things are changing. As a general idea, we have gone from less than 10% of our 911 calls having symptoms possibly consistent with COVID to 30% of our 911 calls having symptoms possibly consistent with COVID. Our hospital bed delays, and that's offloading patients at the ER, have increased exponentially over the last few weeks to the point where on a daily basis we are having in the neighborhood of 40 or 50 ambulances wait over an hour to offload their patients at the ER. And that's simply because the ER has no space or no staff for those patients due to the number of people already in the ER. Our overall transport volume at EMS is up significantly. We are right now where we would normally be in the peak of a busy spring season. And at this time of year, we should be nowhere near there historically. We are seeing some cases and calls coming from congregate living facilities such as assisted livings and nursing homes, but we are also seeing, as are the hospitals, a generally younger cohort of patients that are being affected and seeking care at this point. So the EMS system is clearly in a mode where we're pulling out every available contingency to continue providing excellent care to the citizens, but we truly are using every available resource and running out of any further surge capacity. We've already increased the number of trucks on the road, utilized resources we don't normally utilize, and are really doing everything we can to keep up with the surge. From our partners at the hospitals, we've heard, I think Dr. Cho mentioned, that there's a significant percentage of the patients in the hospital are COVID patients, anywhere between 20 and I think 35% at one hospital of all of the patients in the hospital are there with COVID. We are seeing generally, as I mentioned, a younger group of people, mostly in the 30 to 50-year-old range, that are seeking care for severe symptoms like difficulty breathing, shortness of breath. We are also seeing that ICUs are filling up with those sicker patients as well, and we did in fact hear one hospital say that they are running short on ventilators and are going to need to request emergency ventilators as well. So I think it's clear that this surge in cases is overall affecting a younger cohort of people, but the rapid nature of this surge, the rapid increase in the number of patients, and the fact that we've got more patients needing medical care from COVID than at any time previously during this entire pandemic is truly putting a significant strain on both the EMS system and the hospital systems.
Okay. So I think, Commissioners, to kind of summarize, Dr. Jameson and working with our partners at both with our EMS and fire rescue agencies, along with our hospitals, they're putting in the protocols that they can to help mitigate the situation. They're looking at different options. Greg Hare's looking at different options that they can implement that'll address the capacity issue. They're working with our hospitals on how to speed up that process for transport, to be able to free up so they're looking at all available options. But what you clearly heard is that we have an issue with COVID. And the way to get out of this is through vaccination. And that's what we're continuing to stress. We're asking for those real live examples, for those that just think it's not a big deal, I won't get that sick, and they're a younger population, which we all have family members that think that, we're saying it is real, and if you are willing to get a vaccine, please get it. That helps break that cycle. That continues to be our push, our stress, and we'll continue to try to encourage people to do so. That concludes our report. Regardless of what's been heard, we're not suggesting any other types of actions or mandates. We're simply outlining that we have a community health issue. It is impacting our healthcare system, and that we have a solution in our vaccination process, and there's plenty of vaccines available. We'd be happy to take any questions.
Okay, thank you. Commissioner Flowers.
Thank you, Mr. Chair. First of all, Dr. Cho and Dr. Jameson, thank you for a very thorough report and an update. I appreciate all that you're doing. And Dr. Cho, the number is astounding but very encouraging. Over 600 people going to be tested yesterday. So that's absolutely wonderful. Thank you so much for that. The question I have for you, Dr. Jameson, is I know that we can go look at the CDC dashboard, but since I'm not doing it right now, do you have a number as it relates to just how many available beds we have within Pinellas County, within our hospitals, how many open available ICU beds that we have, in Pinellas County, and if you have any indicator as it relates to staffing, any issues, concerns with staffing, having to do double shifts, et cetera. Do you have any of that information?
So I don't have specific numbers of open beds for Pinellas County because that reporting mechanism was discontinued previously. So if you look on the CDC website, they do show a county drill down that will show our county, and it shows that nearly 30% of our ICU beds in the county are currently being used by COVID patients. So I don't have the open bed number, but I think that's at least one data point that can show you that there's a significant amount of COVID patients in our hospitals and in our ICUs.
And the second question regarding staffing, are we seeing any issues and concerns with ramping up for staffing, or are we looking at traveling nurses again, or where are we with that?
Sure. I think we're consistently hearing from our hospital partners that staffing remains a very significant issue for them. And I think that's universal at this point among our hospital staffing or among our hospital partners. As one said to me the other day, the FEMA nurses aren't here this time. And so they are, assure me they're doing everything they can in terms of trying to bring in travelers, but those are not necessarily readily available at this point. So yes, staffing does clearly remain a significant part of this issue.
And where are we with PPE for our medical professionals, just assuring, other than, I know you said that we are running low on ventilators at one specific facility, and I know that since we're making that identifier early, you know, there's time to reach out, but what about other PPE equipment that those staff members may need?
I don't believe we heard widespread reports of PPE shortages from the hospitals on the call. I know that we at EMS have increased our baseline PPE use in response to the increased number of patients with COVID that we're seeing in an effort to keep our providers safe. But I have not heard widespread PPE shortages at this point. I know emergency management is working closely with the hospitals to help them with whatever needs they do have.
Okay, and my last comment is just super kudos to the ambulance transport staff as well as EMTs for having to, you know, be and work with those patients for that time frame, whether it's an hour or longer, before they can actually even get into the hospital you know, into the emergency room. And so I know while those specific vehicles are well equipped, you know, it's still not the same as if you are actually in the hospital with all of the additional equipment they have in there. So for any of them that may be watching or sharing information, super kudos to them as well. Thank you so much, Mr. Chair.
You're welcome. Yeah, just maybe it goes to both of you. How do we help our residents manage the process? And when I say that, I know 3 weeks ago, and I have been vaccinated, but I went to an event where I was later called and told that I would have been exposed. I'd been with somebody an hour and a half. I pretty much decided on my own just to stay home, stay as, you know, just to wait to see for symptoms if there were any, and testing process. But I was even going through that myself, a little bit confused on what we're supposed to do, when we're supposed to do it. And again, this is all just trying to be careful and not add to the spread. So maybe, is there a place, Dr. Cho, where people can go, like if you're exposed, what you need to do, when you need to be tested? Don't get tested too early because it won't show, and then you know, that kind of thing. Is there any place that we can go or send our residents to help them manage the process once they're in it?
So you have some good points. In terms of some of the guidelines, there has been some changes. As we learn more, especially about the Delta variant, the CDC does have a lot of great information. We'll make sure that our pages do link to that. But for any of those questions, talking to a physician as well as our EPI department is something that we can do, and I'll make sure that that's readily available.
Okay, on your website?
Yes, sir.
Okay.
Could I make a comment to that as well, please?
Yeah, please, go ahead, doctor.
So I think it's very important for people to understand that the rules have changed a little bit with Delta. Delta is significantly more contagious than the previous versions. And so ideas like the 6-foot separation don't necessarily actually apply anymore. We've seen the virus become much more contagious. And so what I would encourage you is that vaccines are absolutely 100% the most vital thing we can do. But in addition to that, and in the meantime, knowing that from the time of your first shot till the time you're actually protected is in the neighborhood of 6 weeks, there are steps that people can take in the meantime. And that includes the same things we've always been saying in terms of social distancing, wearing a mask when appropriate, hand hygiene, et cetera. Those strategies still need to be in play and still need to be part of our toolbox as we get people vaccinated.
Okay, thank you. I didn't finish, I guess, my comment on my personal experience. I went for about 4 or 5 days, didn't get any symptoms. At the suggestion of a doctor, I went and I got tested and was negative. Waited a couple more days, and I didn't develop any symptoms at all, and I clearly was very fortunate. But I just wanted to pass along. It was very confusing for me to navigate exactly what I needed to do, when I needed to do it, just to manage what could be a spreading type thing. And I'm not trying to overreact to it. I'm just trying to explain what I went through and how we can help each other out a little bit. So I think that's important. Are there any other questions? Yeah, Commissioner Long.
Yes. Thank you, Mr. Chair. And I'm not sure if my question is for Dr. Jameson or Dr. Cho, but I either read or saw on the news that a large majority of our firefighters and EMTs were not vaccinated, and I would like to get a better handle on that, since they clearly are our first responders and are interacting already with folks that are really sick or potentially really sick. I know Mark is here in the audience, Mark Postma, and perhaps he has some thoughts on that as well. But for the two doctors on the screen, maybe you can speak to it a little bit. Thank you.
Sure. So first, I think it's important to know that regardless of a first responder's vaccine status, we are taking appropriate precautions so that they are not a potential source of infection to our patients. I think that's very important. The universal protective equipment that they're wearing prevents both ways of transmission. And so we've been very, very happy with the fact that we haven't had any documented cases of a first responder getting COVID from a patient. But similarly, we believe that the steps we've taken have prevented the other way. So I don't want there to be any confusion that it might be dangerous to interact with a first responder. The second part of that is that we do have a good number of our first responders vaccinated. But I cannot tell you the exact number because those are not reported to me. I am working very hard to help them to make good decisions in terms of vaccines, but I can't tell you an exact number of how many of them are vaccinated, unfortunately.
Thank you.
I do want to echo those comments too. Obviously, we're going to encourage everyone to make the right decisions, get vaccinated. It's especially more important if you're working with high-risk individuals. So like fire EMS, other healthcare workers in the hospitals, and other congregate settings like long-term care facilities where we want the staff to be vaccinated. And the last number I think I saw with long-term care staff is about 50%.
Okay, thank you. Any other comments, questions? Yes, Commissioner Peters.
Thank you, Mr. Chair. So I got a couple of things. Dr. Cho, over the last year and a half now, we've seen these in 8-week cycles. And so I'm curious where we are in the 8-week cycle this round. Are we at week 2? Are we at week 3? Are we at week 4? When do we see the peak and then the decline?
So there's a few different projection models out there, and as we've seen really through this pandemic, it's been highly variable. So it's hard make those types of predictions. The ones I've seen the most recently, and I've seen it from 2 different places, some people believe that it may be at the end of in about 2 weeks versus 3 weeks. But again, as we've seen, the projections have been variable.
Okay, so you don't know if we're on week 2, week 3. You know, I talked to a couple of hospitals yesterday, and they really weren't sure either if this was week 2 or week 3, if we were expecting another climb for the peak for another week or maybe 2. So that would be good data for us to have, and that way we, you know, it makes it a lot easier for us to plan. The other thing is I was told, and I'd have to look at the 2 of you to confirm that the vast majority, vast majority, 80-90% of the people in the hospital were not vaccinated. So people who were vaccinated are not getting hospitalized. Is that what you 2 are seeing?
Yes. I think that's consistent with what they're seeing at a federal as well as statewide level. I believe it ranged anywhere from 80% to 90% of those hospitalized are not vaccinated.
Okay, so I think that's really important information that needs to be out. But what I fear the most, and I know Commissioner Flowers asked about staffing. I'm very aware that the hospitals are having difficulty staffing up with nurses. We are aware we're making changes for EMS because EMS is having difficulties with staffing. So I do know that the staffing is playing an issue. But my fear is with the media and with all of the talk that we have going on right now, especially just the way things are being reported, that we are going to see again, like we did last year, people afraid to go to the hospital and then staying at home and dying unnecessarily. And so what I would like to see is any messaging that we're going to do being clear, first off, that people that are getting the vaccination, the science is working, the science is true, that they're not going in, they're not being hospitalized. It's not a big number that are getting COVID, especially severely, but that it is safe to be going to our hospitals. Not all the beds are full in every single hospital in this county. And so that's my worry, is that we're going to have people just like a year ago, and it was about a year ago this time, when people were dying at home of a heart attack or a stroke because they were too afraid to go to the hospital. And the way things are being reported today is so reminiscent of what it was a year ago that I have real concerns that that's going to repeat itself. And so I think definitely, the messaging has to be that if you are vaccinated, it's safe if you have to go to the hospital. If, as you said, 86% of our seniors have been vaccinated, I wouldn't want our 86% of seniors that might be suffering from a heart attack or stroke be afraid to go to the hospital. And so I think the messaging has to be clear about other safety issues that, and if the science works on the vaccines, then believe that the science works on the vaccine, and that's our messaging. But I don't want people dying unnecessarily, and I worry that that's going to happen, or it already is happening. And I don't know if you have any take on that. Maybe I'm wrong. Dr. Jameson, you may know if that's the case. If we're going to people far too late for 911 calls, you witnessed this last year. Is that happening again? Or I'm just not sure. You may know. Maybe I'm worried for nothing, but I don't think I am.
Yeah, I actually agree with you. We did certainly see that trend, not just here locally, but across the country last year during the early phases of the pandemic. And I have started to see a little bit of reluctance among people to go to the hospital because they're scared by the number of COVID patients there. And so my response would be twofold. One, the hospitals have been doing this for a while now and are very good at keeping people safe in the hospital and separate from COVID patients. And so while I understand the reluctance or the fear, I think it's important to be clear that the hospitals are very well capable of keeping people safe at this point. So I would hope that we can overcome some of that fear. But I think the second part of this has to be that, we've spoken for a long time about protecting the healthcare system so that other disease processes, whether that's a heart attack, a stroke, or a car accident, don't have the care for those disease processes compromised. And the way to do that is to try to get things under control here. And the way to do that is to get vaccinated.
And just to reiterate, then isn't it also important that the messaging is, if you've been vaccinated, your resiliency is so much better. The fact that they're vaccinated, I think somehow we have to script that. And I think somehow when we talk to the media, whether it's you or Dr. Cho or Barry, that we, talk about the science of the vaccine and that seniors are protected, they will be resilient, it is safe to go to the hospital, for a lot of things. And so anyways, that's just my comment. You didn't have to respond, but I think that's really critically important in our messaging so that we don't have those unnecessary deaths.
Yeah, you guys referenced a little bit ago in the beginning of your comments about our congregate care living facilities. Last year, when we started to go down this road, we had a lot of problems. It's a different day, thankfully. Do we feel that that we are still connected well in our database and information flow with our congregate care living facilities to have a real good handle on how we're doing there? Obviously, that's an avenue we don't need again, but yeah.
Dr. Cho, go ahead.
Yeah, so on our end, in terms of epidemiology, we've worked with the congregate care facilities. They reach out. I think I think we've come a long way since last year. A number of them do have COVID isolation wings, so that has been in place. However, there is a handful, especially the smaller ones, some of the ALFs that do not have adequate, and again, these are few and far in between, that have resulted in some transport. However, that does, again, add to the burden within the healthcare system. So we are working with partners as well as those facilities to make sure that placement is safe and that they can be appropriately isolated.
Okay.
But I think that to your question, it's being managed. It's not the large outbreaks that we saw last year. Yeah. And so that kind of goes to the point of the vaccine works because we're seeing the numbers at such a high rate of people being vaccinated within the congregate care settings that kind of reinforces that point. Yeah. If we can get to higher levels, it's manageable.
Okay. But last year when we started that process, our communication system really needed to be worked on, points of contact with each of those facilities. And I know we did a lot of work to get up to speed on that. And so that's what I was checking.
Yeah, it was really a number of issues, infection control practices within the facilities because they're overseen by the state, and so there was a number of issues. That's where our fire paramedics really helped out, and stepped up and worked hand in hand, place by place with our congregate care facilities.
Okay, great. Okay, yes, Commissioner Justice.
Thank you, Mr. Chairman. Dr. Cho, what have you heard about the approval of the vaccines and also the expansion of age ranges for the vaccines?
Okay. So in terms of those under the age of 12, I understand that it won't probably be reviewed until the end of September. Now, in terms of full approval of the Pfizer vaccine, that is the FDA is reviewing now. It is believed that should be, if everything goes okay, be fully approved by September. I think there's always a misnomer. Right now, those vaccines that are under an emergency use authorization, I think people think of that word as experimental, which is not the case. The same safety protocols were used for the development and approval of those vaccines. It's more the administrative processes for that full approval. They did the same phase studies in terms of safety and efficacy. But regardless, in terms of the Pfizer vaccine, that should hopefully be approved by early September.
Thank you.
Commissioner Gerard?
Just one little question. Have you heard anything about boosters for Pfizer and Moderna?
I'm aware other countries have actually initiated that in terms of, I think Israel has started that. I know what the U.S. FDA is currently looking at is the need for a booster, especially for the immunocompromised. Obviously, with that patient population, they have a less, just with their immune system as it is, it cannot produce those antibody response. So they are looking at a booster for that special population, probably first before anybody else here in the U.S. And I don't have a timeline for that.
Okay. And then one of the things that came up over the last year, I'm not seeing any more questions at this point. We'll probably get to our residents here, but was a lot of discussion about wellness, what we can each do individually to improve our health, our own health, as it relates to anything, whether it's this issue that we're talking about or anything else. So I just asked the doctors, what public outfacing do we have available? I know we do, but if you could just say that. So folks can go there at their leisure, they can talk to their doctors, they can talk to whoever they need to talk about a complete wellness, whether it's physical, whether it's nutritional, whether it's mental health wellness, whatever it is. What can our residents do, not just for this issue, but just for any issue on those items? Thank you.
Well, number one, I do encourage you to speak to your physician on that. Number two, obviously, from our standpoint, we will continue to promote healthy activities, healthy eating, and I think that's important. I think from our standpoint as a community, we need to ensure that those access points are there so that we can make the healthy choice the easy choice. And I think from the public health side, that is something we're working with community partners on. But certainly, even whether it's this or really any infection, those with chronic health conditions are always going to be at higher risk. People that fall into the obesity range, diabetes, heart disease. So making sure that that secondary prevention is there, as well as working with the physicians and making sure those conditions are under control.
Yeah, I think that's an area that we can work with our community and get that messaging out maybe a little more creatively and succinctly so that our residents are pretty adept at finding their own solutions and being healthy, but anytime we can assist in that regard, I think it's a positive thing and certainly something we can always improve on. So, okay, I think it's, I don't see any other comments or questions, so at this point I'm going to go ahead to our residents, and I started to say a minute ago before I realized that we needed to hear the presentation first, thank you, Barry, that we've had, good messaging this morning from our partners down in Lellman and our veterans on Purple Heart, and I'm looking forward to hearing from our residents today. And on the citizens cards that I've seen here, there are many of them that want to talk about the issue that we were just going through. Some have other issues to deal with as well. Again, I would ask folks as they come forward to please address the commission as a whole, not individuals. We're just not going to tolerate that. I think you can get your message directly to all of us, and it will be received individually as appropriate. So with that said, and I don't want to beat that one to death because I know our residents are very respectful. So we're going to go ahead and get started on that, and we're going to start with, and I'm going to try to read, again, 3 names at a time. We have about, looks like about 30 folks that want to talk under citizen input in total, and so we're going to go ahead and get started. First with Fred Irwin, and then we will move to Ed Dye and James White. Fred Irwin, Ed Dye, and James White. And you see the timer.
Good morning.
The timer there.
I want to thank you for recognizing veterans. I've been in military service for 30 years, and we certainly appreciate your support. My name is Fred Irwin. I live on Sand Key. I represent 27 condominium associations on Sand Key. There are 3,008 units on Sand Key. It's approximately 5,000 residents. And Jim White, who is a member of our technical committee, is also here today, and he'll be speaking after me. You will hear from Nancy Labarre later on via Zoom. She represents ABC with roughly 10,000 units in St. Petersburg. We would like to congratulate both Senator Ed Hooper and Representative Nick DeCagley on their Florida Fire Prevention Code bill, which was recently passed. And I've sent a one-pager to all of you. I don't know if it's in your file, but if it isn't, I'm sure it'll be distributed. And the one-pager outlines the bill, which is HB 1209, covering the Florida Fire Prevention Code. And as you'll see in the bill, it does not state how to make high-rises compliant, nor does it state who is responsible for this. And the mandate of the Pinellas County Radio and Technology Services is to resolve any communications problems with their users and recommend technical solutions to best suit their customers' needs. That's a direct quote from their website. Now, this is not a county issue. This is not a state issue. This is a national issue. And other counties have already taken action to resolve this issue. And looking at a select number of residents in the county to financially support this would be enormous. And I'll give you just an example. It would cost the 27 condominium associations on Sand Key alone $4.6 million. And our estimate for Pinellas County, when you consider all hotels, hospitals, condominium associations, schools, office, and municipal buildings, to comply with the regulation that has been suggested, it would cost roughly $300 million. There are other technical solutions. Jim White will address these. And as I said, it is a county responsibility to support their first responders. And it would cost less than 8% of this $300 million. Now, I know that you have many issues on your table. This is the first time I've addressed you, and I've enjoyed listening to all these issues. Jim Fogarty, who is also here, and his team are doing a truly outstanding job. And he should be complimented on what his and his team have done. But our recommendation is that you initiate a public service communications study by a neutral organization recommending enhancements to your current communication systems to comply with HB 1209, and then commission a firm to implement these enhancements. And I want to thank you very much for your attention.
Thank you, Fred. Appreciate it. Okay, Ed Dye, James White, and then Jeffrey Caputo.
My name is Ed Dye. My address is 12610 Frank Drive North in Seminole, Florida, and I've lived in Pinellas County for the past 42 years. Thank you for the opportunity to speak this morning. I got very interested in solutions to what I recognized as a serious threat from continuing to burn fossil fuels back in the late 70s when President Carter first put solar panels on the White House. It was nearly 30 years after we built the house we live in now before we could afford to put solar panels on our roof. And I believe thanks mainly to the misinformation campaign of the fossil fuel industry. And I've never been politically active, but after watching the lack of concern about the climate crisis continuing to dominate the news media, I realized that I had to speak out and assist with spreading the truth about the climate crisis. So in March of 2019, I traveled to Atlanta to be trained by Al Gore and become a climate reality leader. As a climate reality leader, I give presentations to local groups about how serious the climate crisis is, how it will most likely affect those living in this area, and the solutions we have today to solve the climate crisis. And if you have the time, I would be happy to give the board one of my presentations. As chair of the Pinellas County Climate Reality Leadership Corps, I represent over 40 climate advocates who sincerely urge you to adopt a resolution setting goals to transition to 100% clean energy by a date based on science that is consistent with the 2018 IPCC targets. There is a tremendous momentum behind this idea, demonstrated by 200 municipalities, including 4 here in Pinellas County and the city of Tampa, who have made these commitments. Further, there are huge economic benefits rooted largely in the fact that renewables are now cheaper than fossil fuels. Being a coastal community, doing all that we can to address the climate crisis is critical to the future health and prosperity of our citizens, economy, and infrastructure. I appreciate the fact that the Commission has hired a sustainability coordinator who is crafting a new sustainability and resiliency plan to create a roadmap. But the urgency of this crisis is of the foremost consideration. And we need to heed the science and adapt goals that align with the science. These goals can provide the sustainability coordinator with a clear understanding of what the sustainability and resiliency objectives should be. Thank you very much.
Thank you, Ed. All right, James White, Jeffrey Caputo, Tracy Kepler.
Chairman and Commissioners, I'm Jim White, a resident of Bel Air for over 15 years and served for many years on the Bel Air Infrastructure Committee and as president of the RPD. I represent 16 condo associations with 690 units and 1,000 residents. After graduation from West Point, I was commissioned in the Army Signal Corps, was sent to graduate school for a master's degree in electrical engineering, and served for 26 years providing communications service in Vietnam, Korea, Germany, and South America. The Army had a simple expression: to be successful in combat, you need to move, shoot, and communicate. One of my military assignments was with the White House Communications Agency, where we supported the President, his staff, the Secret Service with worldwide communications. Their radios had to work. When unqualified contractors started as a business opportunity doing communication surveys in the RPD, selling $100,000 bidirectional amplifier systems, I got an FCC license to understand that work. I strongly feel that communications is a key county infrastructure, like water, sewer, electrical grid, and road network. Communications must support our police and first responders, whether they are in parks, between buildings, in buildings, or on the highway. A couple of corny examples of the situation I feel we're in. Are you going to buy a cell phone from a vendor that has not installed enough cell towers to give you adequate cell phone coverage? If you were selling hearing aids to a room full of hearing impaired individuals, could you not sell more hearing aids if you didn't have a good sound system in that room? Communications vendors make 10 times more profit selling BDA systems than selling an improved county communications system. In our Zoom conference last week with County Communications, they pointed out installation of BDA systems in side-by-side buildings can cause significant communications problems. We just spent $100,000 each for 2 side-by-side buildings and to get occupancy permits from Largo Fire. There's a good chance that one of those $100,000 systems will need to be turned off. St. Petersburg just had a BDA system turned off because it caused radio interference. The county communication system is a key county infrastructure and needs to be managed by county radio with the help of an independent radio study, as was done in Manatee and Sarasota counties. There is too much money involved not to do an independent analysis. Currently, we have 19 fire districts wagging the tail, so to speak, of the county's radio infrastructure dog. Thank you.
Thank you. Thank you, James. Appreciate it.
Thank you.
Jeffrey Caputo, Tracy Kepler, and then Paolo Atanati.
Hi, Jeff Caputo, St. Petersburg, Florida. Kind of going off book. Just based on publicly available data, I've seen that target utilizations of hospitals are typically at 80 to 90%. I've seen that. So I'm looking at the HHS site, so I don't know how current that is. I've heard numbers. They vary. You know, I'm seeing COVID hospitalizations at 13% with a 77% general occupancy. I'm seeing ICU occupancy at 81% with 23% COVID. So my question is, I'm not making any statements because I'm not a healthcare professional, but how much, to what degree are these COVID patients overwhelming hospital capacity to where it would constitute a state of emergency to where it's exceeding that 80 to 90% typical target utilization capacity, if that's indeed a fact or not? I don't know. Those are some questions that I'd like to see answered or probed further into. And then another thing is we're hearing about the staffing issues. So are the staffing issues, is that because not enough people want to work for a hospital? Or is it because hospital CEOs are making decisions to increase their profit margins? Again, I don't know that. I have no idea. I'm not a hospital administrator. That's not my expertise. But I'd like to know, okay, is there an emergency, an imminent emergency? Is that going to be because of staffing issues, because of hospital CEO decisions, or is it because of not enough people working? Is it because of COVID patients overwhelming that excess capacity? I don't know that. I'd like to see that. I'd like to know as far as people being hospitalized, are these people with underlying conditions that are known to cause severe illness warranting hospitalization? Again, I don't know that. Like, do we have a breakdown? Okay, were these people hospitalized? Did they have underlying conditions? Do they have one underlying condition? What do they have? Do they have diabetes? Were they obese? Was it one of the top 10? I don't know that. I have no idea. I'd like to know that. Or are the people that are hospitalized for COVID, do they have is it just a perfectly healthy individual that is of a normal weight, that eats right? I don't know that. And then we're seeing a lot of messaging on the vaccine. They're saying, oh, well, this doesn't really inoculate you. It just helps you, from getting, severe illness and going to the hospital. It just prevents you from that. Well, if that's the case, there's tons of peer-reviewed journals out there showing ivermectin, hydroxychloroquine. I'll try to email each one of the commissioners. Renee Flowers is my rep, by the way, in St. Pete. Hello. I'd like to email all of you all of that, too. We're seeing vitamin D, vitamins, all that stuff. 3 minutes is up.
Thank you, Jeff.
All right.
Appreciate it. Tracy Kepler, Paolo Atanati, and Angela Dubak. Hi, welcome.
Hi, thank you. I'm here in response to some concerning comments made last week. Just want to kind of respond to those. First, the reason I feel there's no longer as much confidence in this Board of Commission is because of the overreach from the whole past year, overstepping onto our health and medical rights. Second, all students are not vaccinated. Many of them have religious and medical exemptions. Also, please stop comparing injecting a substance into our bodies to wearing a seatbelt. Third, you have no burden to make people's health and medical choices for them. That is government overreach. So long as the vaccine is available to all who want it, which it obviously is, then you've done your job. If you would like to be burdened with something, I suggest you look into why the effective early onset treatment of ivermectin is now being refused to be dispensed by some pharmacies in Pinellas County. If you truly are concerned about keeping people out of the hospital and not dying, that seems a little bit odd to me that that would be allowed to go on. So if you can look into that, I'd appreciate it. Lastly, you referred to the county as your buildings. Correction, they are our buildings as taxpayers. And I have no desire to be refused at my local public library again this year over another ridiculous mask mandate or worse. The virus is obviously here to stay, and we must all learn to live with it. For some, it'll be improving their own health and immune system. For others, it may be a vaccine, wearing a mask, or self-isolating, or perhaps a combination. The point is, it's up to each individual to manage their health and their life. Please do not infringe on this again. And I also hope that we don't spend the kind of money that was spent on that Rise and Shine campaign last year for masking. Based on some of the comments made last week, I really hope we're not going to spend my tax dollars on some kind of similar campaign for a vaccine. The vaccine is available. Everybody who wants it can get it. Please leave our health decisions up to us. Thank you.
Thank you, Tracy. Paolo Attanati, Angela Dubak, and then Greg Pound. Paolo, I may not have gotten your last name. I apologize.
That's all right. Ammanati. It's Ammanati.
Okay.
I would like to, first of all, talk about the size of these viruses. These viruses, they are measuring nanometers. And to make it so that everybody understands that, means that a virus, it's 2.5 million times smaller than an inch. Let me repeat that. 2.5 million times smaller than an inch. What a mask is going to do to stop that? There is not a mask that can stop that. As a matter of fact, the only thing that the mask is going to do is going to force the person that wears it to breathe carbon dioxide and to limit the amount of oxygen that is so necessary for our survival. As a matter of fact, a child that keeps a young person a mask at school for so many hours is going to have some problems with his memory and with his brain because of the lack of oxygen. Plus, by touching the mask continuously, it's going to become, because of the vapor that it comes from our lungs, it's going to become a breeding ground of bacteria and viruses. I moved to the United States in Florida, as a matter of fact, in this county 30 years ago. Somebody that talked prior said that his family has been here since the 1800s. I've been here only for a small little amount of time. But the reason why I moved down here is because of the freedom that this country allows to the people that live here. And unfortunately, this liberty that I so dearly love, the Constitution that I swear for when I became an American citizen, I can see it slipping away. I can see that unfortunately there is somebody else that has to make the decision for myself. I'm a son of God, and I'm so grateful that it was a pastor that he started this meeting with a prayer. This is something that you don't see in Italy. This is something that you do not see in a lot of places. And I feel and I believe in my Savior, Jesus Christ, and it's only through him that I can be saved, not only spiritually, but also physically. Maybe we have forgotten that the founding fathers, when they basically put together this Constitution, they needed to pray to receive directions to be able to decide which way we should go. I believe strongly that we still should do the same thing, that we still should ask for divine guidance, so that the decisions that we make, they are not only our decisions, but the decision that our Savior had trust in us. I'm grateful for this opportunity that I have to say whatever is in my heart, and I hope that you guys are going to make the decision that is right with God. Thank you.
Thank you, Paolo. All right, Angela Dubak, Greg Pound, and Elizabeth Fox. Hi, welcome.
Hello. I'm Angela Dubal, chapter chair here in Pinellas for Moms for Liberty. Okay, let me get this straight. Someone has a sniffle, cough, sore throat, they go and get tested. Okay, it's never the flu, it's never a cold, it's always COVID, right? Okay. So why is the current PCR testing being discontinued? Because according to the CDC, it's inaccurate. How do you know it's Delta? My understanding, in order to determine that specific test has to be sent off to do a special genome sequencing. Is that being done with all these cases? Can somebody please explain that to me? You know what this meeting should be about in regards to our children, what they're really dying of, and it's not COVID. This meeting needs to be about the actual flu. teen suicide at all-time high, bullying, anxiety, depression, and mental illness. And for all of you that want our children in our community to be forced to wear masks, your child has a greater chance of dying in a car accident on the way to school than they do of COVID. The problem here is that a lot of you think the American people, the people of Pinellas County are stupid, and they need the government to tell us how to live our lives. This fear-mongering and lying needs to stop, and it needs to stop now.
Okay, Greg Pound, Elizabeth Fox, and then James Lechner.
Greg Pound, Pinellas County. I would just like to read a verse. This comes out of Psalms 9:17. The wicked shall be turned into hell in a nation that forgets God. We need national repentance and turning back to the Bible, teach it in school, stopping sex outside of marriage. Now, there is something wrong with the populace. When you come in here, the reason I have this mask on is because when it's time for citizens to be heard, their voice isn't lining up to what's being said. Now, if these people behind me, these citizens that come here and can't figure that out and figure out the mindset behind it, the science behind that, that's why we have leaders and followers. I mean, they come in here and talk, but their voice, you watch when they're talking. So I put my mask on so you're not going to do that to me. People are going to be able to hear me without trying to concentrate on what the word the guy's saying, because his mouth is moving, but he's saying something different. So what we have is massive corruption and fraud now, out of control. My daughter was sexually molested by DCF in this county. All my children, by your illegal sheriff, Robert Guattieri. That guy should be in prison. When they give my daughter, sheriff's department gives her $2,000 not to prosecute this guy that was a DCF one of the caretakers, molest my daughter, Jim Palermo, and nothing's done. Now, you guys are a part of that. I've been coming after you guys for a long time. I'm not giving up. And the Creator in heaven and earth is going to hold you people. The destruction of his family comes about by destroying our families. All our problems, this Bible from Genesis to Revelation is built on one thing. It's called families. And when our families are wiped out, we ain't going to get nothing done. Because you'll sell everything out for, if you don't have a family, you have nothing to live for, nothing to die for, and that's what we're under attack. It's not the COVID, it's our families. That's where it's at. And this is where we're at. And so if this country doesn't take it back, if the men in America, listen, the sheriff's department and the deputies, when the black guy that ran for sheriff had to leave town because he had the guts to stand up against the criminals running the sheriff's department, Randall Jones, he had to leave town 18 years after being on the sheriff's department. He knew what was going on. And so this is what we've got. We've got this inner circle now of people running the country. We can't get nothing done. We come here, bring our issues before you, and nothing's done about it. Just like the vote the last time on the property issue in St. Pete about building apartments. So we've been sold out. If the people don't realize it, that you put money before truth, the Bible says the truth, buy the truth and don't sell it. You can't. It's not to be sold for nothing. Nothing. The Word of God is not, the truth is not to be sold. Marriage is, God ordained it for one man, one woman, till death do you part.
Elizabeth Fox, James Lechner, and Andra Griffin. You see Elizabeth Fox or James Lechner? Hello, welcome.
Good morning. My name is James Lechner. I'm a Pinellas County resident for many years. I love it here. I don't like what's happening. I don't want to be remembered. I homeschool 3 boys, and I don't want to be remembered for what I do or what I say. I want to be remembered for who I stand for. I stand for Christ. So apart from my words, the last time I was here, I exhorted you all through God's words. We don't fear anything. As a follower of Christ, we fear nothing. We don't even fear death. But what is our contention? Our contention is, who do you fear? And I concluded with, when all has been heard, fear God and keep his commandments. because this applies to every person. For God will bring every act to judgment, everything which is hidden, whether it is good or evil. So we have to evaluate every phase of our life, every step, every decision that we make. We're going to be held accountable. Even as a believer, that sometimes scares me, because the thoughts will be held accountable. My intentions will be held accountable. So I want to read from God's words on how we can do that right now. He says, therefore, if you have been raised up with Christ, keep seeking the things above, where Christ is, seated at the right hand of God. Set your mind on the things above, not on the things on earth. For you have died, and your life is hidden with Christ in God. When Christ, who is our life, is revealed, then you also will be revealed with him in glory. Therefore, consider the members of your earthly body as dead to immorality, impurity, passion, evil desire, and greed, which amounts to idolatry. For it is because of these things that the wrath of God will come upon the sons of disobedience. And in them you also once walked when you were living in them. But now you also put them all aside: anger, wrath, malice, slander, and abusive speech from your mouth. Do not lie to one another, since you laid aside the old self with its evil practices, and have put on the new self, which is being renewed to a true knowledge according to the image of the one who created him. A renewal in which there is no distinction between Greek or Jew, circumcised or uncircumcised, barbarian, Scythian, slave or free man, but Christ is all and in all. My time is running up. Thus says the Lord.
Thank you, James. One more time for Elizabeth Fox, Andra Griffin, Jill Gibbs, and Kevin. And say that again? Sorry?
I was asking them to please pay attention to what I have to say. They're all doing work here, and I want to make sure that you guys hear my message. please.
And ma'am, just keep in mind also, please hold off on the clock. People are taking notes about what you're saying,
Okay.
too. So don't assume that they're not listening. Go ahead.
So my name's Andrew Griffin. I'm a Florida activist here, and I come around to counties, and it's all about the same thing. You guys want to mask the people in your county. You want to lock them down. And I just want to know, we had a pandemic, right? How many times have you guys looked at your computer and actually researched, did independent research of yourself, for yourself? How many times has Dr. Cho not looked at a report and actually done independent research for himself? Probably none. Probably none. I can tell you I've clocked 1,000 hours last year cross-referencing and referencing all this information. So the hospitals get $56 million of CARES money, and there is no excuse to have shortage in staff. None. Absolutely none. So if they're doing that, they're doing it for manipulation purposes only. That's the only excuse for that. You guys are talking about vaccine. You guys had 65% of 12 and up, first shots, 57 fully vaccinated. 86% of your senior population has been vaccinated. These are your numbers that you have provided me, okay? Explain to me why your numbers are shooting through the roof if this stuff's working. Just please explain that to me. So if masks really work, why is there this mysterious increase in numbers? There's only two reasons. Either vaccines and masks don't work, and in case that's the case, then why are you putting masks back on your citizens? These are failed policies that do not work, and the only other reason would be that the numbers are being manipulated. So you can't have vaccines that are working and masks that are working and numbers going through the roof, or people are manipulating the numbers. This is called problem-solving, critical thinking. The other thing is the ignorance of thinking that a human being can stop a virus. You honestly think that all these things, do you really think these dividers here that you guys got are going to stop you? People that deal with the coronavirus are in hazmat suit. And the conundrum would be if this disease was so contagious, why is the entire homeless population not wiped out? Not one person out of this entire year and a half has ever been able to answer that question. So in my last 36 seconds, I'm going to ask you to not force masks on your people. Don't do it. It's not working. If it hasn't worked in this amount of time, 16 months, if it hasn't worked yet, it's not going to work. Thank you.
Thank you. Jill Gibbs, Dr. Kevin Stillwagon, and David Happy. Jill Gibbs, Dr. Stillwagon, and David Happy. Yep, okay.
Dr. Kevin Stillwagon. I'm retired and living the dream in Clearwater Beach. I have 10 lies for you today. Number one, there was a deadly pandemic in 2020. The truth is, less people died worldwide in 2020 than in 2019. If there was a deadly pandemic, it does not matter what you call the cause of death, there would have been a huge spike in deaths, and there wasn't one. So there was no deadly pandemic. Two, the virus is deadly. The truth is, this virus is a coronavirus. It's in the same family as the common cold, and it is less deadly than the flu. It is not a virus that kills you. It is the subsequent pneumonia and cardiovascular problems in the severely immunosuppressed that is deadly, just as it has always been with all coronaviruses. Three, if you test positive, you're a threat. The truth is, we all breathe 100 million viruses every single day, whether we wear a mask or not. The viruses get trapped in your mucus naturally. So if you look for it there, you will find it there, and that does not mean that you are infected or even will be infected. That is why millions of people who tested positive never got sick. Four, masks stop the spread. The truth is, dozens of peer-reviewed research shows that wearing a mask does not stop the transmission of viruses. In fact, prolonged mask wearing makes you 13 times more likely to develop an upper respiratory infection. Five, there are no COVID-19 treatments available. The truth is self-evident here. Please do your research. Six, the vaccine was extensively tested. The truth is, the tests were only done on healthy people, not the most susceptible. In every other coronavirus vaccine trial up to this point, animals were used. These animals all developed pathogenic priming, meaning that after they were vaccinated and encountered a similar coronavirus, most of them got seriously ill and some of them died. Billions of people are now in this ongoing trial, so I guess we'll see how many of them get seriously ill this coming flu season. Seven, the vaccine is safe. It is not safe. It causes the production of spike proteins, which are toxic and have resulted in heart inflammation and blood clots, even in children, and some of them died. Eight, it is effective. The truth is, many of the new severe COVID-19 cases are in fully vaccinated people, and some of them die. 9, the vaccine will protect you from getting infected. The truth is, the antibodies that result from the shot can only react to an infection, never, ever prevent infection. Fauci even admits that. And the problem is, people, when you try to stop the transmission of a coronavirus that's trying to get through the population with a vaccine, variants will emerge. And they emerge from the vaccinated population, not the unvaccinated. That's exactly what you're seeing right now. That's where these variants are coming from. The good news is, and as one of your doctors mentioned, it is more contagious and gets into the younger population, but it is going to be less damaging. Thank you.
Thank you, Doctor. Jill Gibbs, David Happy, Callie Alonso. I'm not seeing a Jill Gibbs. I've called her a couple of times. David Happy, Callie Alonso, and Gina Lugano.
Thank you for the information today. The following that you're about to hear is just a short clip from your August 3rd, 2021 workshop.
I'm just a little over all of the crazy talk about not trusting government and all of that nonsense, because we're not here just to have fun. I mean, we're all here because we're dedicated public servants. And so, at the very least, I think we ought to be able to do is to mandate masks in the buildings that we own.
So you don't own any buildings. We own buildings. but I want to explain to you a little bit of what happened during your stay-at-home order. So maybe some of you that don't understand, we're not opposed to government. Heck, I was at a kind of a government meeting last night. We are not trusting of you individually. So during the pandemic, you guys might have seen a picture floating around of a little girl that was escorted out of a park, Pinellas County Park, by a sheriff's officer. During your stay-at-home order, that's my little girl in that picture. And during your required stay-at-home order, I thought my little girl needed a little sunshine on her face, so I took her out and we were kicking a ball around and there was nobody within 500 yards of her when at your order, your sheriff came in and removed my little girl and I from the park. So if you're not understanding why people don't trust you individually, it's not government, it's you. You closed our parks and our beaches. You closed our gyms. You called us unessential while you kept getting paid. You shut down our businesses. You forced us to wear masks. You forced our children to wear masks. You took our paychecks from us. And while we were protecting our family, this Pinellas County Board of County Commissioners, on a 6-to-1 vote with one dissenting, raised taxes while we were adhering to your stay-at-home orders. So we're not really interested. You're right, we don't trust you individually. And as a result, we're not really interested in your opinion of who should get vaccinated, of who should wear a mask. You're right, we don't trust you, but it's deeper than that. You don't represent us. So stop with the lectures. We don't report to you, you report to us. And you will never again force Pinellas County to do your bidding.
Thank you. Callie Alonso, Gina Lugano, and Caitlin Northern. Hey,
Hi.
Callie, welcome.
Hi, thank you. Good morning, everybody. So I just wanted to address a couple points that were brought up from what Dr. Cho was saying and a few things that a few of you mentioned. One of them, just to point out on the firefighters aspect of not getting vaccinated, how there is a large percentage of first responders. I actually have a friend who is a firefighter, and he told me the same thing, that they're pushing hard to get them vaccinated, yet in a 2-week period, they responded to 5 people passing away within 24 to 48 hours of getting vaccinated. One person got vaccinated, stood up. It was less than 5 minutes, collapsed. They were in a facility where should be the best place that they can be revived, could not revive this individual. So if people are not getting vaccinated who are responding to that, I can understand why. If I was seeing that happening in front of me, I wouldn't be wanting to get it either. Percentages that we're talking about, Dr. Cho says it's fairly misleading because percentages don't tell you cases. It could be 1 case and then 2, and that's a 100% increase. So I think percentages are definitely misleading and just giving people more fear than is necessary. A lot of this talk is very just, I don't understand why we're pushing the fear so much when there are personal responsibility. There's definitely other handlings. I know plenty of people who have gotten sick and they've all been fine. They all recovered using various things that we have all researched. The data is definitely out there, americasfrontlinedoctors.org. They have lots of things there. So I don't know why we're not pushing for that, and we're saying that only the vaccination is the cure, which is definitely not true. There's a study I just wanted to read you a little bit about. This was SARS-CoV-2 reinfection in a cohort of 43,000 antibody-positive individuals followed for up to 35 weeks. And so they basically did a study. I'm not going to read all of this, but the conclusion was that reinfection is rare. Natural infection appears to elicit strong protection against reinfection with an efficacy of 95% for at least 7 months. They only followed them for the 7 months, so we'll see. So people who have been getting this, we're saying, oh, if you had gotten COVID, still get vaccinated. Well, you actually have antibodies that seem to far surpass what people would get from even a vaccination. So these are alternative things that why are we not talking about it? And why are we trying to scare people and make people afraid to go out? I mean, you've seen it in this last year. It's unbelievable how afraid people are of each other, which I think is not okay. Now I'm about to bring a child into this world, and this is what we have to deal with. I'm standing up here to make sure that I don't have to deal with this, because I don't think this is right, and I don't want to bring somebody into this world who's afraid of others, who cowers at people who are not wearing a mask, who are taught that individuals who are free are trying to harm others. Thank you.
Thank you, Callie. Congratulations, by the way.
Thank you.
Gina Lugano, Caitlin Nothen, and Ellen Lewis. Hi, welcome.
Hey, good afternoon. I was a retina nurse and clinical research nurse for 20 years. I was forced to get the swine flu, well, it was actually just a flu vaccine back during swine flu to protect my elderly patients. A lot of retina patients are elderly diabetics. It ended my career and nearly ended my life. I got encephalitis, carditis, and Guillain-Barré syndrome. Vaccines are never a one-size-fits-all. And I can tell you that vaccine injury is very real. It took me 10 years to be able to somewhat be normal again. I'm here to say you will never fool me again. This agenda obviously has nothing to do with our health. Let's offer people free donuts, beer, burgers, but not tell them how to keep their immune systems healthy with proper diets, exercise, vitamins, and sunshine. I've asked for evidence from the beginning. Where is the science based about mask efficacy? We have all given plenty of studies from physicians and universities proving that they cannot prevent the spread or contraction of a virus. In fact, they weaken our immune systems and cause bad bacterial lung infections. There's no need to fear a virus that has a 99% survival rate, especially when we have great alternative options like hydroxychloroquine and ivermectin. My primary care physician, who has 8,000 patients, has successfully treated many COVID patients from the beginning and kept her patients out of the hospitals. But right now, all of her prescriptions are being denied by all of our local pharmacies. She was in tears because she wants to help her patients be healed, but her hands are being tied, and we need to ask why. The PCR tests, which have been driving this entire agenda, are faulty and were recently revoked from EUA. They were created using a sample of the common cold, and even the creator of that stated these tests are incapable of detecting an isolated virus. If you cycle that test high enough, you can find a virus in anyone. The CDC and NIH have not been basing anything off of real science. Early on, listed on the CDC site itself, I saw them lumping together pneumonia, influenza, and COVID into one group, which they called PIC, causing a false increase in numbers of cases and deaths, and I'm positive that this is what's being done again. My daughters are about to enter high school, and my oldest is about to enter college. The bullying that is going on with them for the pressure to be vaccinated is unreal, and I have told them that vaccine injury is just not worth it. Please allow us to all have our medical freedoms, and please do not mask any of us. Thank you for your time.
Thank you, Gina. Caitlin Nothen, Ellen Lewis, and then Brian Beckman. Welcome.
Thank you. Sorry, my phone just flipped. Pressure, fear, coercion, force, intimidation, manipulation. You are all guilty of these for the past year. This is a satanic agenda. Freedom is the only way out of captivity. Our time here on earth is short. Your time in hell will be longer. I urge you to choose truth and righteousness. And that's all I have to say. I'm going to end this with a song. Because the flag still stands for freedom, and you can't take that away. I'm proud to be an American, where at least I know I'm free. And I won't forget the men who died, who gave that right to me. And I'll proudly stand up next to you and defend her still today. 'Cause there ain't no doubt I love this land. God bless the USA. Thank you very much for your time.
Thank you, Caitlin. Ellen Lewis, Brian Beckman, and Alfred Garbett.
Hello, Commissioners. Thank you so much for this opportunity. Let me start off by saying I do work in a skilled nursing facility overnight shift, so I just got off at 7 a.m. and came straight here, so I may be tired, but I appreciate this opportunity. It was very important to be here. I want to address some things that were mentioned on the August 3rd meeting. A false comparison was made between the COVID vaccine and the vaccines that our children are required to get for high school and elementary school. I want to be clear about something. Those vaccines that are already in place in those schools are already FDA approved and not under clinical trial. This vaccine, the COVID vaccine, is still under clinical trial. And according to clinical trial ethics, it is unethical to in any way force or coerce anyone to participate in that trial. That includes making it mandatory for an education. That is unethical. I'd like to also go over some safety feature things about this vaccine. I went ahead and downloaded the entire adverse reaction database for the 2021 for every adverse reaction to a vaccine in 2021. Flu vaccines had 1,105 adverse reactions. Shingles, 1,181. COVID vaccine, 429,009. That means for the flu vaccine, there was one adverse reaction every 175,384 doses. For the shingles vaccine, one adverse reaction every 14,394, as opposed to the COVID vaccine that has an adverse reaction every 797 doses given. The difference in the safety of this vaccine is drastic and it is noticeable. During your meeting on the 3rd, you mentioned that you don't know why healthcare professionals do not want to get this vaccine. Let me be clear, we don't want to do it because we've done the research ourselves, we've seen the difference in the safety, we don't listen to the "it's safe" talking points, we look it up ourselves and we see. I work on night shift, every single person on my night shift doesn't want this because they know it has a very high likelihood of adverse side effects. I also want to be clear, do not feel any pressure as a vaccinated person for my safety. I take responsibility for that. That is not on any vaccinated person to feel responsible for my health and safety. And as for the trust in this body, the mistrust of government is built into the very fabric of this nation. It is why this nation became a nation. The reason you are feeling our displeasure right now more than you ever have before is because your feet are on our necks more than they ever have before, and we are angry and we are not going to stand for it. Thank you so much for your time.
Thank you, Ellen. Brian Beckman, Alfred Garbutt, and then David Ballard Geddes Jr.
Hello, Commissioners. Thank you so much for the time to speak today. My name is Brian Beckman. I'm the chairperson for our Suncoast Sierra Club. I'm here to ask for your help and for your leadership to set goals and chart a path forward for the county to address the urgent need to lower carbon emissions. The latest UN climate report has now declared a code red for humanity due to the increasing CO2 in our atmosphere, resulting in higher temperatures, rising water, and more extreme weather. Of course, Pinellas is one of the most vulnerable areas in the United States for those effects. Unfortunately, Duke Energy of Florida has taken a major step backward this year, more than doubling their use of coal per their most recent 10-year site plan filed this spring to the Public Service Commission. The good news is that municipalities in Pinellas and the state are leading to address these urgent issues. Those leaders include local universities, Largo, Dunedin, St. Pete, Safety Harbor, Sarasota, and now, as recent as last week, Tampa, by setting very visible and critical clean energy and emission goals. These goals are driving policies and action on energy efficiencies, installation of zero-emission energy, and purchasing clean energy. They're also saving money that can be reinvested in the community. It is very inspiring by your own creation of both a sustainability coordinator and energy manager positions on your county staff. They position Pinellas extremely well to set critical goals and take urgent action and to save money. In the coming days and weeks, myself and others will try to share and illustrate the goals and actions taken by the municipalities, businesses, churches, residents. This includes helping low and moderate income households to lower their energy bills. Your help, your leadership is extremely important to our future, for our economy, for our quality of life, for our health, both near-term and long-term. Thank you so much for your help and for your service, especially during these difficult circumstances. Thank you.
Thank you, Brian. Alfred Garbutt, David Ballard Geddes Jr., and then Jonathan, looks like Ritchie, or Riches.
Hi, good morning, Commissioners. David Ballard Geddes Jr. I live on Georgia Avenue in Palm Harbor. In 1801, the Danbury Baptists wrote a letter to Thomas Jefferson, commonly known as the Wall of Separation. The letter is written as notice, warning to Thomas Jefferson, stating to those who wish to rise to wealth and importance on the impoverishment and subjection of the people, dares not to assume such a prerogative. The 14th Amendment, birthing, naturalizing, or simply giving rise to water jurisdictions, unfortunately, is the assailing of such a prerogative. As based on the Declaration of Independence, the 14th Amendment elevates the British as being privileged and immune, giving rise to British wealth and importance. The Due Process Clause of taking liberty, property, and life is the subjection of the religion of Christianity in the 14th Amendment, intent on vanquishing the Christians as based on Federalist Paper Number 2. The eminent domaining of Christian properties is seen in the Interlocal Cooperation Act of 1969, which is seen in Statute 16301, and the further taking of personal property and real property is recognized in Statute 15303, Section 5. Even further, the Reclaim Water Variance application states the literal owing of our health, safety, and religion as formulated using the calculated philosophy and prince-like strategy of Baruch Spinoza from the mid-1600s, the Indians tax-free in the 14th Amendment as based on Federalist Paper 42 as the tribes of Israel tax-free in the 14th Amendment. The polarizing involvement of Israel's money laundering in this country in union with the British is clearly seen in Statute 218.415, Section 16, and this prerogative is soon to hit a wall. Whether you're a Democrat, Republican, male, female, transgender, or other, black or white, carpetbagging British Protestant, or a calculated money laundering Jewish person, assailing such political discourse in the pursuit of wealth and importance on the deliberate subjection and impoverishment of others to suit your own personal aggrandizement of individual power and prestige in this country shall not be tolerated. Giving rise to such 14th Amendment political attributes shall result in a wholesale legal backlash condemning all such ill-natured, lawless political waylays on a constitutional platform. I urge all of our government to stand down on this issue. Thank you.
All right, Alfred Garbutt, again, I'll ask one more time. Then Jonathan Riches, Amber Simmons.
Hello, good morning. Jonathan Riches.
Welcome.
Thank you. Thank you. Community. I'm with Community Patriots, born to ride for 45. First, God bless the Purple Heart freedom fighters that were recognized today. They made a lot of sacrifices for the freedoms that we have today. Thank you very much, and thank you for the board here for recognizing them. Thank you for having freedom in this country. We're not going to let it get taken away. I know a lot of people are watching this online. A lot of the radical leftist, Karens, Marxists, communists. Ha ha! You ain't getting your mask mandate today. Ha ha! Nikki Fried, I know you're watching. You ain't getting a mask mandate in Pinellas County. No masks. No masks. This is the chicken dance. No masks. no mask, it's your birthday, it's your birthday. Hey, I look good on cam. But yeah, I have, when freedom is here, it's a great day to celebrate. We are not doing masks in Pinellas County. Our great governor, Ron DeSantis, God bless him and God bless his family. He's from Pinellas County. He said weeks ago, no mask mandates, no restrictions, Florida is free. Florida is free, baby. It's going to remain free in Pinellas County. You can bet on that. And any rogue commissioner that wants to, have a mask mandate, just like Governor DeSantis said the other day to the school boards and the school superintendents, he will take away your salary. He will take away your salary. We're not playing anymore. We're not playing anymore, Janet Long. We're not playing. You saw all the people. Excuse me?
I just asked you not to direct any names
Sure.
specifically.
God bless you.
You're doing great so far.
Yeah, see, there's a lot of mistrust with Dr. Cho, right? Because of HIPAA laws, right? So you guys are getting medical advice from someone that wasn't appointed or wasn't elected in Pinellas County, and he's giving medical advice with all these numbers, right? But he doesn't say, like, the people being admitted to hospitals might have pre-existing conditions, they might have obesity issues, they might have heart issues. That's a personal responsibility. It's our right, and we should have personal responsibility to be healthy. That's how it should work. No mask mandates. We say no. If you institute any mask mandates, we are going to protest. We are going to protest. We are out there. We were out there today. You've seen a lot of people speak. So all you leftists out there, you didn't win today. We won. Patriots won today. God bless Pinellas County.
Okay. Amber Simmons, Audra Christian, and Ruth Wonderly. Amber Simmons, Audra Christian. Hi, welcome.
Hey, good to see you guys again. So I want to thank Miss Peters over here for standing up for our rights for a year. I really appreciate that, Miss Peters. We really do. Everybody sings your praises everywhere we go. I mean, I never hear a bad word about her. Now, you guys over here, something very different. Yeah. And regarding Dr. Cho's push for the vaccine, I would like to say thank God we have the flu vaccine because we don't have the flu anymore. I mean, thank God we have that, because if we did not have the flu vaccine, we would have flu everywhere, right? No, that doesn't work that way, guys. Viruses morph and change. That's what they do. And you heard actual doctors here. So I don't know if Dr. Cho's an actual doctor or if he has a doctorate degree and he works for the government. I don't know. It's a little different. Anyway, I just want to let you guys know this. Now, a lot of people are talking scientific, my science, your science. Well, science is science. Otherwise, it's called your opinion. Right? It doesn't go both ways. The science is the search for truth. So you can't have my science, your science. It's actual search for truth. Another thing I want to let you know is when I talk about COVID, I'm not talking about one day something out here. I actually had COVID. I had a really, really bad case of COVID-19. It was so bad, I was so sick, I was afraid. Right? And I'm a good Republican, so I was like, oh, crap, how did I catch COVID? I shouldn't be able to catch COVID, right? Because I don't even agree with it. But you know what? I got it. And do you know what helped me? A doctor prescribed me something called ivermectin. Ivermectin. In 2 days, I was back. In 2 days. Dr. Cho, did you hear that? Ivermectin. Within 4 days, you couldn't even find the virus in my body. So I would like to know why we're doing all these weird, strange treatments on people, keeping them in the hospital for weeks at a time, not letting their families see them. When, dude, all you have to do, prescribe ivermectin, Dr. Cho. I mean, unless you have an agenda. I mean, ivermectin, my own body, 4 days. 4 days. No ventilator, no death. Guys, you need to be honest with yourselves. And I would also like to say that you guys are not political genies. You didn't get a hat, little snake in a basket. We come up, we rub your bellies. Oh, please, Commissioner, grant my wish. That's not what you do. You're supposed to follow the Constitution. You are not our mothers. You don't tell us what's best for us. You follow the Constitution. Don't roll your eyes, Janet. I know you're tired. It takes a lot to sit here.
Thank you.
Don't roll your eyes at me.
All right, Amber Simmons, Ruth Wonderly, and Linda Skempris. Amber Simmons, Ruth Wonderly, Linda Skempris, Pastor Mack. Hi, welcome.
Hi, thank you for having us. My name is Ruth Wonderly, and I just wanted to speak to the information that has been said about the hospital situation, and that what people are being told, the general public, is not the truth of what is actually happening in the hospitals. I had COVID, as the previous lady said, I had COVID, and I did end up hospitalized for 5 days. I had bronchitis and pneumonia and a pulmonary embolism, and I never needed oxygen. I was never on a ventilator, but I was hospitalized because of the severity of my infection and my virus. And the hospital staff, the nurses in the COVID unit, were telling me that A, they did not feel comfortable getting the vaccine in the COVID unit. They deal with it every single day, and they did not feel comfortable getting the vaccine because of how little that there was information about it. And B, they told me that on a regular basis in their COVID unit that they were in every single day, 50 to 75% of the COVID patients in the COVID unit and the ICU are fully vaccinated. The government and the community and the news is trying to tell you that that is not true. That people, even our own Governor DeSantis, I love him, he's an amazing governor, but even he said that people who are hospitalized are not vaccinated. That is not true at all. I've had other people from other hospitals that were in other hospitals tell me the exact same thing that I experienced, is that the nurses and the doctors in the hospital are telling you this is not true. A vast majority, when I was in the COVID unit, at the time, there were 9 of us. 2 of us were unvaccinated. The rest had all been fully vaccinated. And they were in the COVID unit, in the hospital, that they were that sick. So what exactly is it supposed to be doing? How is that helping us? I went through all of that, and I will tell you, I would rather have done that than get the vaccine. I don't trust it. It is not proven. I've had personal family members who have gotten adverse reactions to it. It's been shown to not be safe, and yet why is it still being forced on us? I'm very thankful that I've already planned on homeschooling my child, because I will absolutely not put her in a school that would force her to be vaccinated. Children don't even get severe COVID. If they do, it's a common cold at most. And I would not put harmful chemicals and untested medications in my child's body. And thank you for your time.
Thank you, Ruth. Linda Skempris, Pastor Mack, Chris Steiner. Good morning, welcome.
Hi. Good morning. My name is Linda Skempris. I live at 8043 Causeway Boulevard, South St. Petersburg. The biggest cause of death is obesity-related stress. The second cause is stress, born, and fear. As long as you keep the fear-mongering with the Chinese virus, you will have more emergency room calls and ambulance calls. The fear is real. The mind is strong. As long as people's minds are bombarded with this news of the virus constantly, the more people will think they have the virus. A relative of mine works in admissions at Mayo Clinic and saw many come in thinking they had the virus when they had sniffles and a cough. People are being bullied into getting the jab who are not vaccinated, and and being threatened, by threatening mandates. It's too much of this. I'm against all these mandates and everything like that. I, for one, will not comply by ever getting any vaccines. And also, Mr. Cho, you are not the be-all, as Senator Rand Paul said. Thank you.
Thank you. Pastor Mack and Chris Steiner, and then we have a few that are coming in Zoom. So we'll go to Kat in just a minute. Good morning, Pastor Mack.
Morning, sir. And ma'am, then thank you again for a great opportunity to stand and just say a few words from our Lord to all of our hearts. I'm just so encouraged with so many that's so concerned about this great county that I've been a part of nearly all my life. Man, I've been here forever. And I've just seen so many great things take place, and I'm excited to see people with that great, powerful concern for this powerful county. But I was just thinking about all this information and insight that we've received from so many concerned folk in this county, and my mind reverted back to Solomon. Solomon, the Bible teaches, is the wisest man that ever lived. And what that means is this man tried everything. Everything was what he was a part of. And he concluded, with all this wisdom and knowledge and insight that I have, the conclusion of life is to simply learn God, fear God, and enjoy life. And I think that's the calling that we have today. But the Lord gave me a couple of verses here from the book of James, in James 4, verse 26. And it says that as the body without the spirit is dead, so faith without works is dead. Now the Bible, the Word of God, teaches us that the Christian is one who trusts Christ as Savior and obey Him as the Lord of their life. That is the essence of the Christian discipleship, believing and following. Now the New Testament makes no separation of belief and obedience. New Testament teaches they're more or less linked together as one, because if you truly believe, you truly will follow. Trust makes us a part of the kingdom, but our love for God and obedience to His will are the badges of our citizenship in that kingdom. Now, I worked for the county back in the 80s, the late 80s, and when I worked there, I went there as a worker. I was just a worker, but by the same token, God had called me to preach way back in those days. And so when I went on that job, I had a tendency of telling people about Jesus Christ, because really, when you study God's call for all of us that are Christian, that's what we're called to do. And so I would tell people about Jesus on the job, and the next thing I know, people were all over me saying, man, you can't talk about the Bible on the job. I said, okay. I mean, finally I got the picture. And as I got the picture, people would come to me. Sometimes people come to preachers. Oh man, my time's gone already. But anyway, we'll continue next time.
Yeah,
God
Pastor
bless
Mack, it's always good to hear from
you. Faith
you.
without works is dead.
Thank you. Chris Steiner. Good morning. Welcome.
Thank you. Good morning. I'm Chris Steiner, host of Liberation Station radio show. That's Liberation Station at theliberationstation.com. And it's on 6 Florida stations, Tuesdays, 8 to 10 p.m. Eastern Time, and 1340 a.m. out of Clearwater, 106.1 FM out of Clearwater as well, and transmitters out of Dade City and Zephyr Hills. I'd like to play a clip from the last edition of The High Wire with Del Bigtree, August 5th, 2021. He's just reading some headlines, and he sources all of this on the website at thehighwire.com.
COVID spreading fast in well-vaccinated California counties. Fully vaccinated Cary couples shocked and disappointed after both become sick from COVID. Piers Morgan caught COVID at Euro 2020 finals despite being double jabbed. Maston and Care in Wallingford dealing with COVID-19 outbreak of the fully vaccinated. COVID outbreak among vaccinated Vegas hospital workers underscores Delta risks. Breakthrough COVID cases among vaccinated players postpones MLB game. Shooting for Hollywood film shuts down after vaccinated cast. All of them get COVID. Sixth fully vaccinated Texas Democrat lawmaker tests positive for COVID-19. Texas Dems slam for super spreader trip as Biden Pelosi aides catch COVID, all of whom were vaccinated. 2 passengers test positive for COVID on Celebrity Millennium fully vaccinated cruise. Outdoor wedding, 6 fully vaccinated infected with COVID-19 Delta variant. Stanford students concerned about breakthrough COVID cases after 7 fully vaccinated test positive. Church camp COVID outbreak, 20 fully vaccinated residents test positive, health officials say. 28 fully vaccinated people contract COVID at homeless shelter in California. Minnesota finds 89 COVID cases in vaccinated people. COVID-19 infects about 100 vaccinated crew members on HMS Queen Elizabeth. TDH, more than 1,000 breakthrough COVID cases reported in Tennessee. Reports half of COVID-19 infected adults in Israel in latest outbreak were fully vaccinated. So far, 5,800 fully vaccinated people have caught COVID anyway in U.S., CDC says. Fully vaccinated New Orleans woman dies of COVID, age 33, in rare breakthrough case.
Well, I think you've heard enough. I wanted to also point out the fact that, and you can hear more, of course, at thehighwire.com. I'd like to point out the fact that all of you county commissioners in 2012 who voted for water fluoridation do not care about the health sensitive, those who are on kidney dialysis, the young and the elderly. If you cared about those who were more sensitive, then you would not have voted for water fluoridation, you who are on this board in 2012. If you cared about oxygen, the vital nutrient that we need, then we would allow the unobstructed intake of oxygen. Coronavirus and other viruses, other harmful germs, 99% of which are anaerobic, can't survive in the presence of oxygen. You're only aggravating the problem. And coronavirus is not the only germ, just because there's a vaccine for it, that you need to be afraid of.
Thank you, Chris. Okay, that's all the cards I had from in the House, and we have several online. Kat, let's go to those folks now. Thank you.
Thank you, Mr. Chair. We do have 9 individuals who have pre-registered to speak on this agenda item online. The first individual is Mr. Michael Biamonte. Mr. Biamonte, if you have joined us, if you could raise your hand in the Zoom application so that we can unmute you on this item. Mr. Michael Biamonte? And Mr. Chair, it does not appear that he has joined us. I'm moving on to the next speaker. Ms. Dolores Glass. Ms. Glass, if you have joined us, if you could raise your hand in the Zoom application today. Again, that's Ms. Dolores Glass. And Mr. Chair, it does not appear that Ms. Glass has joined us today, so I'm going to move on to our next speaker, Ms. Kathy Smith. Ms. Smith, if you could raise your hand in the Zoom application so that we can unmute you to speak today. Ms. Kathy Smith. And Mr. Chair, it does not appear that she has joined us today. So I'm going to move on. Ms. Brooke Arrett. Again, Ms. Brooke Arrett, if you could raise your hand in the Zoom application. I think we lost a few in the process. Mr. Bruce Feldman, if you could raise your hand in the Zoom application. And sir, once you're unmuted, if you could state and spell your name for the record, state your address. You will have 3 minutes, sir.
Hello, it's Bruce Poppy Feldman. I live in Dunedin. It's Bruce, B-R-U-C-E, F-E-L-D-M-A-N. Coming before you today, I know there's a lot of people have been talking about the distrust of the government, and there's ample reason for that. One of my first points I'd like to make, and I know that you guys there don't have a lot of control over it, but please don't tell us that this is about health and safety when our southern border has well over 1 million people coming in, a high percentage of them infected. They're not tested, they're not quarantined, they're not vaccinated, and they're shipped all over the country. So please, don't tell us about health and safety. I know that's not your problem, but that's just one point. Concerning the vaccinations and the distrust in the government, we have been lied to from the very beginning concerning this vaccine. They told us that it would prevent infection, we could get back to a normal life. Well, that has turned out to be completely false. Now the narrative has changed. Instead of preventing infection, they say now it will be less severe and less deadly. Well, all along, this virus has not been very deadly. It's 99% survivable underneath a certain age. There's also been, these vaccines, for respiratory infections, decades of attempts at coronavirus vaccines have failed, and they're ineffective, really, at respiratory infections. That's why we still get the flu. We still have the cold. So as we, looking forward based on past history, that we're going to be perpetually bombarded with continual boosters and other different situations. This is a new flu that we're just going to have to live with. The flu numbers and deaths, as people talked about before, have been, are down. This variant is not any more deadly. It's less deadly. So also, too, that's really annoying that the public health officials and governments are saying that the vaccine is the only way out of this, which that's a bunch of bunk. If the hydroxychloroquine and ivermectin were not blocked, there would be a hell of a lot less hospitalizations. So please, let's just get back to true science. That's the problem. This whole thing has been politicized from the very beginning, and it's really disgusting and discouraging. I'm coming to you via Zoom because I'm at home with COVID. I'm a high-risk individual. I became infected likely from a vaccinated person. And luckily, I had acquired some of the forbidden drug, hydroxychloroquine. And even though I have pre-existing heart conditions, I started hydroxychloroquine right on the very first set of symptoms. And I'm sitting at home. I feel like crap, but I'm not going to the hospital. Based on the fear porn, I should be in the hospital on a ventilator.
Thank you, Bruce. Thank you, Bruce.
Mr. Chair, our next speaker is Ms. Karen Mullins. Ms. Mullins, if you could raise your hand in the Zoom application. And then once you're unmuted, if you could state and spell your name for the record, state your address. You will have 3 minutes, ma'am.
Good morning. My name is Karen Mullins, K-A-R-E-N-M-U-L-L-I-N-S, Dunedin, Florida. Thanks for being here today, commissioners. I originally was going to speak on the Ready for 100 and in support of the Sierra Club's initiative to move Pinellas County into a net zero energy usage. I'm looking forward to the discussions that the commission and the staff will be having on this initiative. Second, I want to thank the commission, each and every one of you, for listening to the rhetoric on the COVID discussion along with the mask mandates. This is an awkward situation that you are in. I commend you for sitting there and listening to our fellow citizens. I would like to say that vaccines are helpful. I would like to say that masks are helpful. And I would also like to say that Dr. Cho is a state of Florida employee under Ron DeSantis. I want to make that clear that Dr. Cho works for the governor, Ron DeSantis, not for Pinellas County. I want to thank you very much and have a good day. Thank you, Chair.
Thank you. Thank you, Karen.
Mr. Chair, our next speaker is Ms. Nancy LeBaire. Ms. LeBaire, if you could raise your hand in the Zoom application. And then once you're unmuted, if you could state and spell your name for the record and state your address. Again, that's Ms. Nancy LeBaire. Ms. Nancy LeBaire, I see that you're on Zoom, so we're going to try to get you unmuted here, ma'am.
Chairman and Commissioners, can you hear me?
Yes, we can hear you. Thank you.
Thank you for the opportunity to speak. My name is Nancy Labar. I reside at 6265 Sun Boulevard, apartment 703 in St. Petersburg, 33715. I'm one of 7 principals that represent the Alliance for Bayway Communities, also known as the ABC, which is a civic organization. We represent 50 organizations along the Pinellas Bayway, which is along the southwest section of the city, along with Eckerd College and the Isla del Sol Yacht and Country Club in St. Petersburg. I would like to address the fire radio communication system, the BDA, with regard to fire safety. First, I want to clearly state that the safety of our first responders and our residents is first and foremost. Our concern is pertaining to the who and what, and with regard to choosing a radio communication solution. If the choice of the system is left to individual groups, an decentralized approach, this opens the door to interoperability problems and will be in the same situation we are now. Thus, it could have the opposite effect of its purpose, to save lives. The research states that the critical technical factor is the design of the radio communication system. First, it must be carefully thought out. Secondly, strategically designed. And thirdly, adequately funded. As we all know, communication is a two-way street. If you have a multifaceted approach to a solution, it will result in various technological communication systems. So how effectively will they be able to communicate with one another? We are suggesting that there be a consistent and unified, more centralized approach in order to achieve a positive end result for all. Therefore, we would like to propose that a study be done by a neutral or independent group to determine the best and most cost-effective system to this solution as a solution. We concur with Fred Irwin, who spoke earlier. We thank you for listening to our concerns and considering our suggestion. On behalf of the ABC, thank you.
Thank you, Nancy.
Mr. Chair, I have 2 remaining speakers. Mr. Craig Murtha, if you could raise your hand in the Zoom application. And once you're unmuted, if you could state and spell your name for the record, state your address, you will have 3 minutes. Oops, and it looks like Mr. Murtha, there we go. Now we're getting him. Mr. Murtha?
Hello.
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 We can hear you, sir.
My name is Craig Murtha, 145 Velma Drive, Largo, Florida. Thank you for everything that you do, and thank you for allowing me to speak today. I'd like to ask the Commission to consider joining the growing number of governments around the world who have joined the Sierra Club's Ready for 100 campaign. Pinellas County is extremely vulnerable to the effects of climate change. So if we don't take climate change seriously, people in less vulnerable places will be less likely to. By committing to clean, renewable energy, we can set an example for other governments and private citizens around the world. We will also show the world that Pinellas County is a forward-thinking place that cares about its citizens. There are many benefits of committing to clean, renewable energy, and there are absolutely no drawbacks. The ideas put forth in the Ready for 100 campaign are not controversial. Most of the county leadership and the citizens are moving in that direction already. We should also remember that the commitment to Ready for 100 is a commitment to a concept, not a contract. There are no penalties if we miss a deadline. There are only benefits of joining the growing number of jurisdictions around the world who are committing to the concept. Although at this time, the governments who have committed to the Ready for 100 campaign are on the leading edge, the day is fast approaching when the entire world will be committed to the Ready for 100 campaign. Let's get ahead of the curve and join those who are leading the way. Of course, climate change is just one of the many problems that we have to solve. I have watched meeting after meeting and have heard the Commission talk about the many needs that are going unmet. All of these needs require investments into our communities. That is why I would ask the Commission to consider leaving the millage rate static for 2021. A millage rate rollback will mostly help the wealthiest citizens while denying the working class the vital services that they deserve. We know that if we do not take care of the health health, safety, and well-being of the working class, we all pay the price as a society. So let's do the prudent and responsible thing and build a stronger and more resilient community together. Thank you very much again, and thank you very much for everything that you do. Have a good day.
Thank you, Craig.
And Mr. Chair, our final speaker on this agenda item is Mr. Dave Silman. Mr. Silman, if you could raise your hand in the Zoom application, and then once you're unmuted, sir, if you could state and spell your name for the record, state your address, you will have 3 minutes.
Good morning. Can you hear me?
Yes.
Thank you. Good morning, Commissioners. Thank you for your time and thank you for your patience. Dave Silman, S-I-L-L-M-A-N, 850 East Lime Street, Tarpon Springs. In 1988, the United Nations and the World Meteorological Organization formed the IPCC, the Intergovernmental Panel on Climate Change, for the purpose of being the most reliable repository of objective scientific information for you all, for policymakers at every level around the world. 195 countries contribute scientists to this cause. For 33 years now, this body of hundreds of scientists have aggregated all the published science in the world. They rigorously peer review it, they analyze it, they synthesize it, and every 5 years or so, they release an exhaustive report. They have a 3+ decades reputation for two primary things. One is sound science. The other is extreme conservatism. The only thing they've really gotten wrong over the years is the speed and the scale with which the damage is manifesting itself, which caused them in 2018 to issue a special report saying that essentially we, humanity, have 12 years. That was 3 years ago. Now we have 9 years to reduce our emissions by 45% by the end of this decade and to decarbonize our economy completely by mid-century. The good news is we can do this. If you haven't already, I hope you'll watch the webinar we produced for you at our local Sierra Club. And as a matter of fact, yesterday the IPCC released another report saying, as stated earlier, that we are at code red for humanity. These dire warnings and these tight targets are at the heart of all the myriad 100% clean energy commitments that are being made across the country. Over 200 cities, counties, and even 9 states and territories have made these commitments to transition to 100% clean energy for their operations and communities in line with the United Nations targets. Hundreds of, over 300 global corporations and the who's who, the most recognized brands, the most powerful corporations are making these goals as well, and the commitments only come faster and faster every year. As you know, just last week, Tampa made this commitment as well. As you know, our local Sierra Club has been asking to get consideration for this resolution to do the same thing here in Pinellas County. We've been having a devil of a time getting on the agenda. We've been having a devil of a time engaging in any dialogue, and just here to ask if perhaps we can get consideration now that the aggregate voice of the global scientific community says that we are at code red for humanity. Thank you and have a good day.
Thank you. Thank you. Appreciate those comments. Looks like there is somebody else online. Can you see a Dave Waddell?
Mr. Waddell pre-registered to speak on agenda item number 28, but I can have him.
Yeah, he's texted me and saying
Sure.
he'd rather talk now.
Sure, Mr.
Yeah.
Chair. I will, Mr. Waddell, when you're unmuted, if you could spell your name, state your address, you'll have 3 minutes, sir.
Yes,
Hi,
David Waddell, AVIDWADDELL, 4835 164th Avenue North, Clearwater 33762. Thank you for the opportunity to speak. I wanted to speak under citizens and item 28, and I registered for both yesterday. First off, I want to thank you for recognizing the military. I'm prior Air Force, and I want to thank everybody on the board and the county and all the citizens in our community for your support through my battle with cancer. I'm giving it a good fight and then slowly getting my strength back. Once again, thank you, and God bless you all for your support and prayers. As far as this COVID thing goes, I tell you, when we're opposed, this became a political ideology. It was blown out of proportion. I think we're going to force ourselves to a point where Mother Nature's just going to take care of it, and so be it. I guess that's the way everybody wants to go if we're not going to work together. Barry, there's something later, and that agenda item 28 is very important that I want to speak to because it's ironic. Recently, we've had something that occurred that I thought would be on the agenda today, and I was shocked to see that it was not. I'm hoping that maybe at a later date that will be scheduled because that needs to, we need to have some discussion on that. I'm walking across the carpet and there's all kinds of stuff that's been swept under the rug, and darned if I'm not having a hard time getting to the other side of the room. 3 years ago, Barry, when you came on board, I wanted to talk to you and you ignored me. 15 years, I've been looking into what's been going on, and I love this county, and that's why I take the time to be a pain in the butt, because I do care. If I didn't care, I'd sell my house and move, but I'm not going to see that happen to the county I love. It's become my second home, and God darn it, we're going to work and we're going to make it work, and it all starts right here. I'm glad that Karen brought up that Chow works for Governor DeSantis, the state, and even the feds. All this confusion has created and made this problem a lot worse. So I'll go back to what I've always said. Everything begins and ends local. God bless you, and thank you for your time.
David, we'll hear from you later on item 28, but that item that you spoke about will be coming at a future agenda, either the next meeting or one in September, okay? All right, I don't have any other folks that are online right now or that need to speak, and we are going to take a break. It's 12:15. We'll do our best to start back at 12:45.
Mr. Chairman, before we take a break, can I just, and nothing about the vaccine, I just wanted to correct something else.
Go ahead.
A comment was made about Randall Jones, who was a sheriff officer here, ran for office. He resigned as a result of him desiring to run for office. Sheriff Gaultier didn't run him out of town. And I didn't want to leave the community with the impression that the sheriff is doing things like that to their employees. Randall Jones is in fact employed. He still works in law enforcement. So Sheriff Gaultier did not run him out of town. And I just didn't want that to go lingering out there, giving the wrong impression about those who serve and protect.
Thank you, Commissioner Flowers.
You're welcome.
All right, we will take a break and be back in a half an hour. Thank you. the consent agenda here in just a minute. What I would like to have the commission consider, and what we'll do is we'll move item, it's the redistricting commission that we're going to be forming. Because of the 22 votes and 7 of us that are voting, I thought after we did the consent agenda, we would address any ground rules that we wanted to do on that, and then take that first vote. And while we continue on with the agenda, Kat will do the kind of counting and such. But and then if we need a second one, then we have plenty of those ballots as well. But I did want to address some ground rules on that before we get started. But that'll be in just a minute. We'll first take on the consent agenda, items 4 through 18. And just as I try to do, I just want to talk about a few items that have dollars associated with them. Under Public Works, we're ranking firms in agreement with Applied Science Consulting, Inc. for engineering, planning, and environmental services for Klosterman Bayou Watershed Management Plan. That is a $349,000 item. SwiftMud is providing $149,000. City of Tarpon Springs, $16,000. I did have a question. It would seem to me, and maybe I just didn't do the math right, but that the balance would be $184,000, and it's showing that the county is paying $133,000. So I just want to make sure that maybe I missed something along the way. If we could just get clarification on that.
Sure, Kelly's here.
Sorry, Kelly. I should have given you that heads up before. So it says that the county's the balance of 133 will be paid by the county, and I just had a different number when I looked at it, closer to $184,000. What number? It's item 14. I'm sorry.
Sorry, I will double check the math. I will double check the math on that, but it should be how we do how we conduct watershed management plans when we're working with the city and the water management district. Is the water management district pays 50% of the total, and then we split the remainder based on our jurisdictional contributions. So I will double check those numbers, but that is how we handle those cost splits.
Okay. Yeah, 50% of that total would be less. Be more than what they're showing here. That's why these numbers, I just want to make sure we're clear on that. That maybe the SwiftMud piece is low.
Sorry, Jill just mentioned, it's the contingency.
Okay. So the numbers that are here are accurate, but
Correct.
There's also, in addition to that, some money for contingent. The balance is because it says the balance of 133 will be paid by the county, and really doesn't talk about, I didn't see the contingency in there. So those are the right numbers. We're on the hook for 133,000 plus any contingencies.
Yes.
So
Yep.
up to 184,000.
If
Okay.
if there's any extra services that we specifically request.
Okay. So right now we're estimating at 133,000, but there's contingencies for up to 184,000, which the county would be paying for.
If we
Okay,
requested
but
those
would SwiftMud
services.
then come into effect and pay half of those contingencies too?
We can, yes.
Okay.
We, each year, I mean, because these are multi-year projects,
Right.
so if it looks like we're going to need additional dollars, we will go back in for another cooperative funding
Okay,
agreement.
so they generally pay at 50%?
Yes, they do.
Regardless. Okay, thank you, Kelly. And then the second item under Public Works was the ranking of firms and agreements for professional engineering services pertaining to environmental and stormwater. There are 8 firms that have been approved. They're each have a 5-year contracts, and each have up to upset limits of $1.7 million. Doesn't mean we're going to use all of it or spend all of it, but for a total of $13,600,000 over that 5-year period. So these are consultants that have been approved and set aside for that use. And then under utilities, we have a award of bid of Gossamer Bay, doing business as Universal Controls, doing some flow meter parts and repairs. It looks like $1.9 million over 5 years, totaling $9.7 million contract for meters, parts, repairs, and calibration services for utilities. Under item 17, award of bid to TLC for sanitary sewer pump repair and improvement contract for $2.1 million a year over times 3 years, or a total of $6.39 million over that 3-year period. And then under business technology, award a bid to Five Rivers IT Inc. and Presidio Holdings, doing business as Presidio Network Solutions for hardware, software, and services, $731,000 per year over 5 years for a total contract of $3.657 million. And those are the items that have dollars associated with them directly. So with that said, and with the corrections, or not corrections, but clarifications from Kelly on that one item, do I have approval? Sorry, Karen has a question. Commissioner Seal.
Yes, thank you. On agenda item 16, they've answered some of my questions about the AMI meter project, but I thought several years ago we went to an AMR replacement, and I thought we had replaced all of those meters, but it sounds like we have still meters that are the original. Go read each individual one. How many AMR meters do we have versus the old analog drinking meters, would you say?
Yeah, so hi, Megan Ross, Director of Utilities. So to answer your question, it's about 10%. We did start replacing any stuck or broken meters that are not functional. We go ahead and replace those with the modified electronic, what's called an AMR meter. And those are compatible with the AMI project, so we won't need to go back and replace those again.
Okay,
Those are about
that's what I
10%.
wanted to make sure was we weren't.
Right. No,
Okay.
they are compatible.
Okay, so we're keeping the AMR meters that we did replace.
Absolutely.
And these are only the broken, really old ones.
Correct.
Okay. All right, thank you very much.
Thank you, Megan. Appreciate it. Any other questions for Megan while she's here? Okay,
Oh,
thank you. Yeah.
just one other, when we do the December 2nd Reclaim Water, could you also talk more about the AMI system that it will be going into place at that point as well?
Sure, we could implement that into the presentation. Absolutely.
Because I know that's a pretty big ticket item.
Yes.
So,
Yeah, that'd be great. Thank you.
okay, thank you very much.
Thank you, Commissioner Seal. Any other questions on the consent items? Now, Commissioner Long made the motion for approval of the consent. A second by Commissioner Gerard. All in favor, say aye. Aye. Any opposed? Motion carries unanimously. Thank you. Okay, we are moving on to our regular agenda, and we're going to move up the number 27, which is appointments to the Pinellas County Redistricting Board. We have nominated, each of us, a person. In District 1, Mark Weinkrantz from Commissioner Long. In District 2, Mary Louise Ambrose from Commissioner Gerard. In District 3, Allison Nall from Commissioner Justice. In District 4, Ron Schultz from myself. In District 5, Christian Ruppel or Rupel, what is it? Do you know? Is it Rupel? Thank you. From Commissioner Seal. In District 6, James Everett from Commissioner Peters. And in District 7, Esther Eugene from Commissioner Flowers. So those 7 have been nominated by each of us individually. On top of that, we need, yes?
Just one thing I wanted to mention, Mr. Chair, before you get to taking any votes, including the ballots. I understand from the clerk that we don't have anybody registered to speak on this item virtually. Just wanted to make sure that you don't have any citizen comment cards or that there's anybody that would like to make a comment before you take action.
Well, I don't see any pre-registered, and I don't have any cards that have been given to me. So, so we have those 7 that have been nominated. In addition to that, we're picking 4 collectively from a group of 22 residents that want to be considered for those positions. We have a ballot in front of us. So I guess the question is, if we have multiple people, more than 4, over 4 votes, do we want to then re-vote amongst those people? I'm not trying to overcomplicate this. I'm trying to be really optimistic that we're going to get 5 or 6 people over 4. Should we just accept the top 4 vote getters, or should we then take those 5 or 6 and then re-vote just exclusively on that group. Commissioner Seal?
I would say if you get, 5 people with 5 votes, and you get enough of those, then they should go to the top. And then if it's, 4 votes or less, then I would say you're right. Let's go through and.
Okay, so if we get more than 4 people of greater than 4 more votes, and we just take the top 4 vote getters at that point, and then the ones that got over 4 votes but didn't elevate to the top 4, we just stop at that point?
If we get people who
Yeah.
are top vote getters, I would agree, but if we don't.
Okay, that's fine,
Yeah.
that's fine. Just want to make sure, because on the optimistic side, that we
Yes.
have more than 4, over 4 votes, I just want to make sure how we wanted to handle that. So if we do that, we're just going to, yes, Commissioner Justice.
So if by some chance we had 4, on this first ballot, we have 4 people who get 4 votes, and only 4 that get 4 votes, then it's done.
Correct. That's the way I see it. Everybody's nodding, yes. So it's just a question of how we handle less than 4 or more than 4. So,
And then
yes.
on the, if that doesn't happen, and we go to a second ballot, will we just eliminate everyone who did not receive any votes?
I think that's another good question. I think that's probably a good idea. So that second ballot will come around. The people that have gotten the 4 votes already will effectively be on our approved list or proposed list. And then yes, go ahead.
Well, that's not how I understand. So if they get 4 votes, if one person gets 4 votes in the first round, they're on?
That's the way that's what I'm asking. That's kind of what we're talking about. It was clear to me if there's 4 that get more than 4 or more, that's done, we're done. But it's all about if we get less than or more than, how we handle it.
I guess my thought is if one person gets 4 and then 21 get 1, then the person who got 4 goes on, they're on it, and then we go to the next board, we only are picking 3. Is that your thought?
That's my thought.
And zeros are out?
Yeah, zeros will just eliminate going forward. And having said all of that, I'm sure there'll be questions as we go along, but I think let's give it a shot. Let's go ahead and take the first vote ballot here and see how we do. Yes, Commissioner Peters, I'm sorry.
So I have a question for Jewel. Does it matter if we make this as nonpartisan as possible? You have 2 people on there that is with 2 parties, right? One is with the Democrat Party and one is with the Republican Party, and that's like been their job. And so, I would think that the best thing to do is be nonpartisan versus taking somebody who's been intricately involved in either party and kind of having that in there. I'd almost rather see nonpartisan people, and I don't know how you all feel about that. But you've got Connor Jewell, who's with the Democratic Party, and Nancy Riley, who's with the Republican Party. If we're going to go partisan, then, I just would rather see us go nonpartisan. And I just don't know how you all feel about that. And when you make your vote, we'll find out how you feel about that. But I didn't know if we should put that on the table or not.
But there are others on here that are either Republican or Democrat or independent, and I don't know.
Right, but these are career people that this is what their career
Okay,
kind of
no,
has
that's
been.
fair enough. It's a fair question.
No?
I don't know how,
No? Okay, that's fine. I just wanted to put it out there, see if that mattered to anybody, and if it
Yeah,
does or it
Commissioner
doesn't.
Justice?
Yeah, I think diversity on the committee is good. Demographic diversity, geographic diversity, but there's several on here that are active in political circles. I don't know what level state committee person, these aren't paid positions. So they're volunteer community activists. So I guess I don't know where we would draw that line of Nancy Riley, obviously very active in the Republican Party, but professionally a realtor. So I don't know where we would draw that line, I guess.
Okay.
Any other thoughts on that? Yes, Commissioner Long.
Well, I find the comment.
Hit your button there. Yeah.
Commissioner Peters, I don't know if you've ever been in the legislature when they were discussing reapportionment, but it's really a very difficult subject matter to look at without a partisan lens. And so I don't know how you do that here. And I think, I agree. I agree to a point, but I can assure you that for most of these folks, I don't really have a clue what their party affiliation is, nor do I care. I mean, if they are willing to serve and work on this, what could potentially be an interesting discussion, you know, they're citizens like everyone else.
And yes, I have worked on it in the legislature when it
And
went
was it
back.
nonpartisan there?
The legislature is different than this county, and in that instance, of course, everything in the legislature is one or the other, but they had to work together to make sure that we weren't favoring any one party, any one district. That's what the law says. The law also states that you can't protect any one district, make sure that someone's district is protected and all this kind of stuff. And so, you know, it's complicated, and I just, you know, I think diversity is great. When I looked at all the applications, I only saw one that was an applicant of color. I think diversion as far as location is very important. And I was just throwing that out there as if you want to make it as nonpartisan and as fair, and yes, absolutely, a lot of these people, we don't know what their affiliations are. That's true. Two of them, we do know very clearly what they are, and one put it very clearly on their application. And so it's the only reason why I brought it up is if that's something that we wanted to be cognizant of, that's one thing. If not, then that's fine. I just threw it out there to have it brought up is all.
I think I'm glad you did. I think it's something that we at least need to address. So just for because I really just kind of went over that quickly. So talk to me about those two people. One's you said has a Republican affiliation, one has a Democrat affiliation. Just what are those roles? I don't know.
Well, sir, you'd have to go to their applications.
Yeah.
Okay, and then Nancy.
Yeah, he is professionally employed by a nonpartisan candidate currently.
Right. I'm just saying that's
Say
what
that, Commissioner Flowers. I didn't hear you.
He is a
Who?
campaign, Connor Jewell
Okay.
is a campaign strategist. He is currently employed with an individual who's running for a nonpartisan office, but that's what he does. And I would assume that that's what Ms. Riley involves herself in as well. I don't know, Ms. Riley, but I'm not saying to dismiss, I was just saying
I
that that's
understand.
what he does.
I was just Commissioner Peters.
I haven't pulled up his application yet, but what struck me was, here. The Director, Democratic Party of Georgia, Regional Organization Director, Florida Democratic Party. And so, field organizer, I don't know if that was the Democratic Party either, but the top two things on his resume were very specific to him working for the Democratic Party, where Nancy Riley doesn't work for the party, but she's a state committee woman, and I'm sure, you know, she would be fair and just as well. I'm just putting it out there that if that was something we were concerned about, or if we truly wanted to try and do as much nonpartisanship. I mean, there are plenty of people on this list that I personally know that are not, they're very nonpartisan, or they're very great at negotiating, and they work with all parties. And so, you know, if it were up to me, I'd want everybody that is people that work with all parties and aren't partisan versus somebody that clearly has spent a career.
So on that person, that's their job?
On their resume, that was their job, yes. That was their job. And so, you know, I'm just throwing it out there. We don't have to, you know, if you all are comfortable with picking partisan people, then that's fine.
Well, I think we have to be careful. Yeah, I think a lot of them are probably partisan in some
Right.
regards. But I think to your point, this is the employment of a person
Right.
is in a party, and I think that's a fair concern. Does anybody else want to eliminate the person that has the career in a party? I mean, I'm just asking. Do we want to go down that road? Jewel, do we have any legal issues to look at, or is that just purely political stuff that we're talking
And
about?
that's really up to this board as to who you want to select from the at-large appointees. There is not a limitation in this regard in your charter. The limitation in your charter is that none of the appointees may be an elected official. And then you all decided yourselves that you wanted the folks to be registered voters, which is not uncommon as a requirement for your other boards, and of course, a citizen of Pinellas County.
Okay, thank you. Anybody else want to weigh in on that item? Yes, Commissioner Justice.
Yeah, thank you, Mr. Chairman. Again, I mean, I get the point. That person is not currently employed by the political party. That person is not getting my vote in the first round, just FYI. But I think
they're not currently employed.
They're not currently employed by the party. They're employed by a candidate for a nonpartisan office, is my understanding.
All right.
But I think you better get your sleeping bag, because if we're going to go through each resume and what their history is and what party.
Yeah, but I hear what you're saying. I appreciate Commissioner Peters bringing it up. I'm glad you're clarifying it. I just kind of didn't look that closely at that candidate. But the fact that they're not currently employed on the Democratic Party, I would say we just move on and select. Yes, Commissioner Gerard?
Yeah, I was going to say the same thing. I'd like to just trust the process and see what happens.
Yeah. Yeah.
We can hash it out after if we end up with ultra partisans on
Yeah,
the
and
four
I think
slots.
what we'll do is we'll move forward. Thank you, Commissioner Peters. Okay, so what we'll do then is we'll go ahead and fill out the first ballot, and when we're finished with that, we'll turn them in, and then we'll continue on with the agenda. Yeah, go ahead.
I did have a quick couple questions. How is this committee being staffed? And I assume there's a county attorney. I know we have a consultant that will be coordinating. Do they have a clerk or administrative person as well? And then are we setting up a redistricting email or point of contact for the public so that they don't get stuff to their personal emails?
There will be emails set up for each of the individuals that you appoint today on the county system so that we can retain those communications because of the public records nature of that. Obviously we need to find out who you all appoint, and then we will inform them and get them instructions on what their login is and all of those kind of tech details. No one from my office is going to be sitting with the redistricting board. We have retained outside counsel for that purpose so that your county attorney's office will remain available to you, the county commission. And we did that in an abundance of caution in case there was disagreement between the redistricting board and the county commission, which I don't anticipate, but certainly is at least a possibility. So there will be an outside consultant and outside legal counsel working with the redistricting board. The clerk is prepared to be there at all of the meetings to take minutes and undertake some of those tasks that we obviously need to do for sunshine meetings. And I think that I was talking with Kevin earlier, but I think there's still, we will have some administrative staff or staff there from the county to really just help with some of the, I guess, more routine functions.
And the consultant that we've hired, the consultant will do the actual producing. So they come and they talk, they decide they want to do something with a map. The consultant will produce that map. This advisory board will review that. Is that the?
That is my understanding, and a map or maps, potentially. But yeah, that is my understanding, is that the consultant would be taking in all the information, any communications, public testimony perhaps at some of the meetings of the redistricting board or community meetings that are planned. But yes, he would be the one producing the work product for the board that they would ultimately vote on as a recommendation to the Board of County Commissioners.
Okay. Commissioner Peters had a question, and then I really want to go on with, were we going to address these things? Joel was prepared to address it under redistricting and the attorney's comment. section, so I wanted to do it this way so we can keep the meeting going. It was the idea to vote, and then let's keep the meeting going, because we could talk on for a while. Commissioner Peters?
I'll defer my question for
Okay,
later.
thank you. All right, we're going to move on to item 22, Emergency Medical Services Authority.
That,
Mr.
if we
Burke.
go back, I'm going back to 19.
Wait a minute, did I jump? All right.
They kind of need those contracts.
No, we need to go back. I thought that was the first one. Apologize. Item number 19,
All
under
right.
Administrative Services.
Item
Mr.
number
Burke.
19 is an award of bid to Centennial Contractors, Harbor Construction, Johnson Lax Construction, New Vista Builders Group. These are our contractors for job order contracting. As you recall back, we modified and took out all of the big items that were originally within this. We've skinnied that down. So it's an upset limit of $6 million for each, $24 million over this 5-year period. And these are for relatively medium and small projects. These are pre-bid items, and that way, if we say we want to paint this wall, they measure the square feet, they take the unit pricing that was in the bid, and then that way you can move quickly on these items.
Okay. So these are for actual contract items
Yeah,
that we're talking about.
yeah, job order
These aren't just management fees.
No.
on
These
contracts.
are
the actual.
This is work. This is actual small construction projects that come up, and rather than going and bidding each item, you're bidding the unit pricing, and that way you have competitive bids, and then you can quickly put those together and complete a project.
So we have 2 of those, right?
We have 4 different groups.
Oh, yeah, I'm sorry. 4 different groups that have that 24 million over 5 years.
That's correct.
And we can use any one of those. Is there an upset limit for each? $6 million? is
$6
the
million
upset limit.
for each one.
Okay. Any other questions on this item? Commissioner Peters on the motion. Okay, Commissioner Gerard on the second. All in favor, say aye. Aye. Any opposed? Motion carries unanimously. Item 20.
This is a resolution adopting the 2021 Community Redevelopment Area Policy. Evan had previously brought this to you with some minor modifications or some modifications. He's here to either answer your questions or provide an updated presentation at your pleasure.
What's the will of the board? A presentation or no? Yes? Okay, Commissioner, yes, we would like a
All
presentation.
right, sounds great.
Thank you.
Evan Johnson, Planning Division, and hopefully there it goes. So yes, as Mr. Burton mentioned, this was a presentation similar presentation that I'd given back in January to you all during a work session, and I will go through it quickly and be glad to answer any questions you might have. So following that January 7th meeting, we had a meeting of our working group, and the CRA working group consists of representatives from each one of our municipal partners that currently has a TIF district. So they all, I gave the same presentation to them, answered questions, et cetera. We then presented to city managers, and then finally came back in May to our CRA working group again. Very minor changes only, nothing really substantive since the last time we have talked. We have had, since May, we've had some conversations with some of our CRA working group members, but all in all, everybody understands the policy. And the good news is our Clearwater, Largo, and Safety Harbor, who are all going through either extensions or creating new CRAs right now, all understand that they will be following this policy as they move forward. So we have definitely been in communication with our partners. Real quickly on the changes, we've reduced the term maximums for urban revitalization CRAs from 30 to 20 years. We've updated our scoring. We've created this idea of a base contribution, which I'll talk a little bit about in a minute. We have a priority match now, which our attempt here is to align funding for county priorities or priority initiatives with county TIF contribution to the CRAs. We're now requiring advisory committees for all of our CRAs as moving forward. And then, of course, we're going to have a more robust and consistent midpoint and review process and performance measures. Right now, we have a bit of a variation in how we do that with each one of our CRAs.
Evan, back to that first item, you said that we're now going to, if somebody comes in for a new CRA, the maximum will be 20 years.
Yes, sir.
In the application. If they come back for an extension or renewal, can they? And would it be 10 years at that point, or?
If it's a new CRA,
Yeah.
Statutorily, they're allowed 40, so you could get up to 20 with the extension.
Okay,
So
up
that
to-
was
it doesn't necessarily mean we grant that, but it could be the 10.
correct. Yes, sir. So
So
it's,
in total, on any renewals, it would be no more than 40.
yes, correct.
20 years initially. And existing ones that come back to us, are they still subject to the 40 total?
No, if they are well, it depends on when they were approved. So I believe 2002 was the cutoff where it used to be 60 years for the older CRAs, and anybody after that's been 40 maximum.
40. Okay, thank you.
So there's a couple pieces to this overall effort. First is what you all have in your agenda package, which is the policy document. So that revises the typologies, the CRA typologies, the length of time, the terms, the contributions, and the priority match establishes that match process, what the county priorities are, the requirement for advisory committees, et cetera. We also have a second document that we're working on within our group and with our working group to more specifically refine the allowable expenditures list, as well as reporting requirements and the detailed methodology for scoring. It's quite long, and I didn't want to have to, inevitably, we want to make sure all of our partners can understand it, and we're all on the same page before we move forward with it. This is just your existing, so I'll skip ahead, but you have these three main categories with your up to 95%, up to 75%, and up to 50% county TIF contributions. The scoring or the scoring criteria that you have identified in the policy document has been modified from your existing policy, but as you can see, it's only been, most of them have not been changed. It's the methodology for how you score them has been made consistent, and then we've added a couple as well that we think more accurately or better measurements of CRAs. The main priorities we've identified are affordable housing, economic development, and mobility. So, obviously looking at all of our plans and projects, we thought these aligned very closely with the work that we've been doing as a county. So we've identified those as our priority areas. Now, those are general areas, and we are working on specific project types that we would say is a priority project versus not. Because our goal here is to make sure that if we're talking about affordable housing, that we consider a building of affordable housing is something that we very much want to see. We don't necessarily want to say that purchasing land, a CRA purchasing a bunch of land for potential affordable housing is our priority. So that's what we're trying to draw with our allowable expenditures. The priority match itself, basically when a CRA plan is being developed, a budget has to be developed as part of that process. So what is now required is a 10-year budget that lays out within relatively accurately what the proposed expenditures are going to be. And if a CRA is looking for a priority match, they will identify what projects in their list should be considered for that match. And so that is going to be our way when we approve a plan moving forward, when you all approve a plan moving forward, that'll be our list to track against and make sure that they're making the progress they said they would. So real quickly, for existing CRAs, this is a policy that is very much targeted at moving forward. So existing CRAs have their own ordinances within the Pinellas County Code. They will continue to follow those ordinances. For new CRAs expansions, we will use the local designation and scoring, and then we're going to review the plan, review their project list, et cetera. And then if you're extension, it's basically the same as a new CRA, with the exception that we're also going to be looking back at your performance over the last several years. And this just shows you the difference between what you have on my left, the current 2018 policy. We can just take urban revitalization. You have up to 30 years right now, or up to 95% contribution. What we're now going to have in the new policy is up to 20 years, a base county contribution of a 70% of the TIF contribution, and then a priority match that could get you up to 95. And so that's how we've created. If the jurisdiction wants to go for a priority match, it could get you up to 95% potentially. Then finally, after this, we're going to continue to work with our working group to finalize the methodology and the procedures, and we will continue to implement with our partners. Glad to answer any questions.
Okay, thank you, Evan. Questions? Nope. Guess not.
Awesome. Thank you so much.
Thank you for the presentation. Okay, no questions. Do I have a motion? Commissioner Justice on the motion, Commissioner Peters on the second. All in favor, say aye. Aye. Any opposed? Motion carries unanimously. Item 21 under Public Works.
So change order number 2, it's a final change order to this 54th Avenue North Drainage project at the Pinellas Trail for $22,528.
All right, have a motion. Did you get, who got, did you get the motion, the second? You got it, okay. Any questions? Barry, I didn't look into the details here. On this part of the, this is the trail, for the Pinellas Trail, right? Did we address any bridge issues in this? Is this getting a bridge, this area?
I've got Kelly here, so
Okay.
rather than me
Yeah,
read
I
what's on
assumed it
here, I'll
did.
let her just address it directly.
Kelly Levy, Director of Public Works. No, this is just a drainage improvement
drainage.
project.
Thank you, Kelly.
We selected 3, and then these all didn't get votes. So I can pass these out to the clerk. So these all got 0, the ones that are blacked out, and then they selected 3.
Okay,
One of them had 5 votes, and the other 2 had 4.
okay. So we'll just hold for now. Just hold for now. Okay, so that clarification. Any other questions? All in favor, say aye. Aye. Any opposed? Motion carries unanimously. Item 22, under Emergency Medical Services.
Item number 22 is the Fifth Amendment to the agreement with Paramedics Logistics of Florida. This is for our ambulance service. As we briefed you one-on-one, we've had a tremendously difficult time addressing staffing issues with paramedics for our first responders. And in this, we've seen the wage structures increase, and as a result, we've just become competitively disadvantaged trying to attract and retain staff. We worked in conjunction with the company to address salary increases that will put us in a more competitive wage over a 3-year period. This allows for an extension of 1 year with the company, but puts us in a better position to be able to attract and retain staff. It's a partnership between us and the company because they're eating part of the cost, we're eating part of that cost, but we're happy to be able to work this out and address this issue. And we have both the company here and Jim Fogarty here if you have any further detailed questions.
Commissioner Steele.
Given what's been experiencing, I am supportive of this, reluctantly, but am supportive. What I'm not so supportive of is adding another year at this point. I mean, I could see going the 2 years to try to stabilize the workforce. And you guys have put in a lot of safeguards for us with the
Correct.
audits and with everything else. So I was really appreciative of, the company has to provide a match. They have to prove that it was used and needed, and a lot of protections. But I just didn't understand why we're adding in another year.
Well, I'll have Jim come up. I'm sure it's because we're trying to recoup the cost associated with increasing the contract, but address that. But, and I'll give Jim and Craig and them a lot of credit in terms of working on this and really trying to bring something that we can address without, we have a contract. They've been a good contractor, but it is a contract. And so, we don't typically open up contracts. You live with the contract you bid. However, because we've seen this market, significantly increase, we also want to make them successful. So that's the reason we're here. But if you can address the commissioner's question, please.
Yes, good afternoon. Jim Fogarty, I'm the Director, Safety and Emergency Services. Commissioner, we appreciated that in order for the company to realize some of the efficiencies not associated with the salary, for instance, the capital cost of putting ambulances in the street and remounting boxes, that capital cost has to be attributed over a longer period of time. And we thought 3 years for instance, they just re-outfitted their fleet, half of their fleet, with the autoload stretchers. And that capital investment that they make in that has to be attributed and depreciated over a significant number of years. So the extra year for this extension would allow for that additional depreciation year, but it would also align with the collective bargaining agreement that the ambulance contractor has. The collective bargaining agreement expires at the 3rd year, and I think to make this work, just again, the idea is to stabilize the workforce, to align it with the collective bargaining agreement was the other reason.
Commissioner Flowers, I'm sorry. Go ahead.
Thank you, Mr. Chair. I just wanted to say that I really appreciate the focus, time, and attention that was drawn into this, even taking into account how much time it takes when they're responding to a COVID patient, what they have to do in order to be able to move to the next call, which that takes an ambulance out of service, And so this will help address some of the concerns that we have related to response times.
Yeah.
And related to the time that they have to get someone to the ER, hold time,
Yeah.
if that's 1 hour, and additional. I do understand the depreciation of any type of equipment that will probably normally 7 to 10 years for depreciation of equipment of that magnitude. So this will kind of help level them out for that. So I know it wasn't an easy conversation to have, but I do appreciate the fact that we were able to go back to the table and look at what the needs are for our community, not knowing kind of what the future may hold as it relates to what's going on with COVID or anything else that may come about, that causes a community health concern versus anything else. I do appreciate Commissioner Seal's inquiry regarding the additional year, but I do see the need based on the economic stretch for this, why that 1 additional year is needed, and then the contract will be renegotiated at that rate of where they are at that point in time. So that's why I'm supporting it, because I was able to understand after I asked all those questions.
Yeah, and it'll be rebid at the end of that contract
Right.
period, and so it aligns with their union contract, and I kind of jumped to the financials, but I also want to say the reason we've got our paramedics and EMTs working extremely hard. This has been a tough year. They've been right at the front line like everybody else, and so a big kudos to them. They've really worked hard this past year, and they're integral and part of our overall emergency response system. And I just don't want that to go unsaid.
Yeah, Jim, if you could just, we originally did this contract, it was a 5-year contract expiring in 2020. We've had 5 amendments. This 5th amendment is asking us to go to 2024. So essentially, did the first contract that we did have the potential for a second term or second 5 years, or was it automatically going to go out to bid?
No, the contract, first of all, I want to recognize my staff. Craig Hare, the Director for Fire Administration, is here to answer detailed questions, as is Mark Posta and John Peterson from the contractor. But the original RFP that was put out competitively was for a 5-year term with 2 allowable 3 years extensions. So the amendment we did in 2020 was the first 3-year extension of that contract. The other changes, the 5 changes, one was a name change, one was a change of the SWAT medics. There was a couple of non-cost administrative changes made during those. This is the 5th one, which we're recommending is for workforce stabilization specifically.
So we're not anticipating any more amendments to extend the term beyond the well, we have 1 3-year term we've already entered into.
Right, so we would have the option at the end of this, assuming the amendment is approved, we would still have the option at that time to amend it for to extend it for 2 additional years. It has to go out for bid every 11 years. It must go out for bid.
So in this contract, this amendment, then we're going to add a 2-year extension as an option. Because really we had 2 3-year extensions, right?
We had 2 3-year extensions. Right. We exercised one of those 2 extensions last year.
Correct.
this contract amendment would still allow for that final
Okay.
change from a 3-year to a 2-year
Okay,
extension.
that's what I was asking.
Yeah,
All right.
yeah, I misspoke on that.
So, okay. Okay, any other questions? Okay. All right, thank you. Anything else? Do I have,
Mr. Chair?
oh, yeah, we did have somebody, excuse me, we did have somebody online Zooming.
Yes.
Thank you.
There is one individual who pre-registered, Ms. Karen Mullins. Once you're unmuted, ma'am, you will have 3 minutes.
Thank you for giving me this opportunity, Mr. Chair. I am concerned about the salaries that the paramedics and EMTs are making currently. We are at a shortage everywhere as far as services in Pinellas County. Under the light that we had originally done a P3 with a nonprofit organization at the beginning of Sunstar. We are now dealing with an alien company who is for-profit. And what I may suggest, and I'd like to take it to the EMS, is that we not only increase the salary, but offer shares in the corporation that's currently running Sunstar in conjunction with Pinellas County. Ownership might make it a little more tolerable to have a salary gap. Just an idea that I had. Thank you so much, Mr. Chair. Have a great day.
Thank you, Karen. Any comments, response? No? Okay. All right. So in all of this, I don't think we had a motion yet, or a motion by Commissioner Long. Did you have the motion? Second from Commissioner Flowers. All in favor, say aye. Aye. Any opposed? Motion carries unanimously. Okay. Before we jump into the next item, we have, Kat's going to pass around the ballots, but give us a little summary, please.
Sure, Mr. Chair. So out of round 1, per the commission's direction, we do have 3 individuals who received 4 or more votes. Out of round number 1, Brian Angst received 4 votes, Johnny Boykins received 5 votes, and Karen Owen received 4 votes. So per the direction of the council, I have, or the commission, I have redrafted the ballot. I've highlighted the names of those 3 individuals. If it's the pleasure of the commission to have them be on there, you'd only select 1 in the next ballot round. And I have eliminated the names of anybody who received 0 votes or who did not receive a vote.
So at this point, we will not, obviously, those 3 have been selected effectively, or at least nominated and put forward, because we're going to take the whole group and approve them. And we have the rest of the ballot, less those who didn't get any votes the first time, that we'll choose 1 from.
Correct.
Vote 1 person. Yes, Commissioner.
Were there any of the other applicants that received 3 votes?
Yes, Commissioner Long. Bruce Livingston received 3 votes.
Okay.
He was the only other person who was close.
Thank you.
Any other questions? All right, pass that ballot out, and we'll vote again, and then we'll get back to the agenda. Thank you. You have them all, Kat? Okay, thank you. All right, let's move on to item 23 under County Attorney.
Under item number 23, I'm requesting authority to initiate litigation in the referenced case. This is a matter that was investigated by the county's Office of Human Rights. It's a matter alleging housing discrimination on the basis of disability.
Okay.
Second.
Commissioner Peters on the motion, Commissioner Long on the second. All in favor, say aye.
Aye.
Any opposed? Okay, motion carries unanimously. Now, back to the redistricting conversation, and I did cut that off. I apologize. Commissioner Justice, did you have anything else? Did you have your question? Commissioner Peters, you're good? Okay. Anybody else have it? Go ahead. Is there anything else that you wanted to bring up, Jewel?
At the agenda review, Mr. Chair, you raised the question and asked about the timing of redistricting and whether it needed to happen in this year or could it happen in other odd-numbered years. So your charter specifically contemplates that the redistricting board be seated within a certain number of days, and I can get that for you, within 30 days, that they are appointed, shortly after the release of the census data. The Census Bureau indicated last week that they expect that data to be made available on August 12th. So hopefully that will be the case. But other than your charter that does, again, like I said, specifically contemplate establishing your redistricting board within 30 days after the U.S. Census provides that data, that's really where the more immediate need comes in. State statutes that talk about redistricting for county commission districts state that they should be done in odd-numbered years, and that county commissions should look at districts so as to keep them as nearly equal in proportion to population as possible. So that's the standard out of the state statute. I did, subsequent to the agenda review last week, speak with our consultant who has done quite a number of work, has done quite a bit of work with other local governments in redistricting over the years. He did tell me that he is aware of at least a couple of counties that have district in odd-numbered years other than right when the census data comes out. He's typically seen that done with counties that are experiencing population growth, where you do see shifting population throughout a county. I'll state the obvious, Pinellas is a bit unique insofar as we don't have a lot of open land where you might see some of those population shifts, like in the counties that he and I discussed, where there was a redistricting undertaken other than immediately subsequent to the release of census data. So yes, you can undertake redistricting in years other than, in this instance, 2021. And the statute contemplates that you would do that to keep the proportion of population within each district fairly close. I can tell you in the past what this county commission has adopted as a standard to establish that proportionality is plus or minus 3%.
Okay.
And that is something that's widely accepted by case law.
But assuming we've each talked to the consultant individually, so he will be bringing to that group issues that we may have raised in addition to the plus or minus 3% movement based on population shifting. Any of those issues he'll bring to them, they'll discuss it and decide if they want to consider it or bring it to us as a recommendation.
Yes, absolutely. And there will obviously be the opportunity for citizen input as well, other than your appointees to the board.
And all of those meetings will be open to the public so people can.
Absolutely.
Okay. Commissioner Peters, you did have.
Yeah, my question was that a colleague of mine in Atlanta said that they were getting the data in August, and I just want to know if you had the same information, and she answered it, that August 12th, that we'd receive some data. And so I would just ask that when it comes in, if you just alert us that it's there, because I don't know if some of you are going to look at maybe doing maps or sitting in or what you might want to, but I find it very interesting and fascinating, so I'd like to see it.
Okay. Anything else? Any other questions for Jewel? Did we have any success? No. Okay.
No, Mr. Chair, there was not a consensus on this last ballot. So if it's the pleasure of the commission, I'm going to remove the individuals from this round who did not receive any votes, and I can repass out the ballots if you'd like.
Sounds good.
Okay, it'll just take me a little bit.
Thank you. Okay. Barry.
Commissioners, we have two updates for you today. First, you had asked for an update on Red Tide and Piney Point with Kelly Levy, so I'd ask first for her to come forward and provide an update regarding everything going on there.
Kelly, before you do, I think you certainly have heard from this commission from time to time, but how much we appreciate your leadership and all of the work that you've done over this past, well, I don't even want to put a time on it because I would probably not do it justice. But I also want to tell you that I've heard from so many people about how appreciative they are of the county, but specifically of your effort, of what you've been able to bring to the table. So I just really want to make sure that you understood that we fully appreciate those efforts, and I know you've heard that. But thank you. Go ahead.
Thank you very much. I appreciate the kind words. Before I jump into the presentation, I just wanted to introduce you to a new staff member who joined us about a month ago. Mr. Dan Mirable is sitting back here. You want to come on up, Dan? He's our new Deputy Director of Public Works. So I have a right hand, if you will, and he joined us from Portland, Maine, by way of Albany, New York, where he has a tremendous amount of public works experience. And I wanted to get him here in front of you so that you knew when I was out that you had another person you could grab.
Yeah.
Originally from Albany, New York, by way of Portland, Maine. Okay, thank you.
Nice
Good
to have
afternoon,
you.
Mr. Chairman, Commissioners. Thank you for the opportunity to speak. As Kelly indicated, my name is Dan Mirable, and I've been in the Deputy Director position for a little over a month now. As far as my background goes, 23 years of experience in local government. 16 of those years I've been in the public works field. Held titles such as Deputy Director, Deputy Commissioner, and Commissioner. And I just want to say I'm extremely thankful and excited about this opportunity with Pinellas County, and I look forward to working with you.
Yeah. Well, welcome. Good to have you aboard.
Yeah, we're keeping him busy already, as you can imagine. So he started, and we had Elsa and Red Tide, and I was wondering if he brought some bad luck with him. But
Yeah, welcome to Florida.
all right, so if you could bring up my presentation, please. Just have a few slides. All right. Sure. All right, so they're getting ready to pull up the presentation, but one thing I just wanted to say, obviously, this isn't our first, Red Tide event here that required a regional response. But the one thing that made this year different than 2018 is that we had a plan. And everything that we learned in 2018 was put forth here, and it really made a huge difference in our ability to respond quickly, and we knew what we were doing. Our plan was already in place, and so that really, really helped make this a successful event as far as Red Tide can be successful. So when they bring up the presentation, you're aware that the red tide concentrations in our area kind of increased there in June 2021, and so what that did for us was to kick off the planning process. Again, we have a good strategic plan with regard to red tide response. We pulled that out, double-checked everything. We got with our internal partners in emergency management, communications, CVB, parks, purchasing, solid waste. We made sure all of our GIS resources were functioning and ready to go so that we had all those pieces in place. And we already started, having those discussions biweekly with all of our partners to make sure that we were hitting all the points and meeting everyone's needs. We had actually reached out to our contractor, DRC Emergency Services, One Piney Point, started discharging, just to make sure that if there was any impacts, we were prepared and ready to bring them on board so that we could respond in a timely way. Again, working with all the cities, it's been a great experience again, having all of our municipal partners, because when you look at especially our coastline, we don't have a lot of property out there. So when we need to stage, we need to stage on city property. When we need to put dumpsters out, a lot of the time we're putting dumpsters on city property. So working with them to get those access agreements in place and in a timely manner, getting our notification list up to date and processing all of that really quickly was very helpful. So, and it couldn't happen, without all of them jumping on board right away. We collaborated with Hillsborough and Manatee County as well. Obviously, the bloom started inside Tampa Bay, and really, we were looking towards each other as to how we could help one another, as well as the city of Tampa. So we started all of those conversations before we actually had impacts on the beach. Coordinating with our state agencies, the Department of Health, Florida Fish and Wildlife, as well as the partners that help with wildlife rescue, Clearwater Marine Aquarium. Reached out to the Department of Environmental Protection as soon as I could to see if there was going to be funding available this go-around, as it was in 2018. And of course, the Tampa Bay Estuary Program was a big part of our team this go-around with the extra monitoring that needed to occur. Our federal partners, working with NOAA, they brought up the respiratory forecast tool and got that in place immediately for our use. The Pinellas County Sheriff's Office was fantastic, getting us eyes on our coast and over the bloom, as well as the Coast Guard getting us offshore so that we could really get a clear understanding of what was coming our way and what we were going to be dealing with. We also have our monitoring effort. Our environmental scientists are out there collecting samples every single day. They're still out there doing that, and we report that information out daily, and we report it out to the public. And that's really the big part, the communication. And it's internal, it's external. We make sure that we hit as many points as we can so that the information is clear, it's timely, it's transparent, and we share it across broad networks. Sorry, I'm having can you advance the slide? It's not moving. Thank you. All right, so we have 2 responses, and in this event, we use both, as we did in 2018. We first started seeing impacts, it was all on our beaches from June 16th through June 28th. And at that point in time, we were focusing on removing the dead fish and red tide debris from our beaches. We deactivated the contractor for a small period of time. During those time periods, the cities handle anything small that lands on the beach. So what we're really doing is supplementing a lot of what the cities are doing. And of course, Tropical Storm Elsa on July 6th, impacted us with regard to red tide and pulled in all this material, concentrated in canals and areas that needed more specialized cleanup. So on July 9th, we reactivated the contractor, but that was totally water-based. So we're out there with the shrimp boats. It's a boat called a We-Do. It basically looks like a front-end loader. You can see it up there in that upper right-hand picture. It scoops the fish out, and then we dump it into a vessel that works alongside the We-Do so that they can keep moving because they don't have any storage on that boat. We held those operations going until July 26th, and then we deactivated the contractor again. So we're really trying to be judicious with the use of the funds. It is a very expensive endeavor, and so we use the vendor when we need them, and then pull them, and then deactivate them when the cities can handle minor work. And then last week, of course, the beaches started to escalate again, and so we worked all last week, and we finished up yesterday, and the contractor is currently on standby for any additional needs. But right now, we are not activated. All right, so when I turned in the presentation, we were at 1,776 tons of red tide debris removed. We are currently at 1,823. tons removed. That comes out to about 3.65 pounds of fish. So those who like to hear pounds instead of tons,
3.5 million.
3.65 million pounds. Thank you. Yes. So it's a lot. It's a lot of material, and kudos to our solid waste department because they accepted all of it regardless of where it was coming from. So it's a lot of work to, I mean, they have their daily work, and then they have this on top of it. So, and they work with us on the weekends as well, so for storage and things. So it's extra work for them, and they did a great job as they usually do. We had requests for a lot more notification with regard to public health, and we worked with the Department of Health to get an approved sign and had those printed up and distributed in less than 48 hours so that they were at all the beach locations for beach access points and boat ramps. We pulled together the agreement with the Florida Department of Environmental Protection for the first amount, $902,500. And we are doing some invoicing right now, working with the department on that. And then the plan is to have a supplementary request to cover the rest of our expenditures. To date, right now, we're at approximately $2.1 million expended. So the department did indicate that they have additional funds available to cover everything, so that's good news. On the 24th of this month, we're bringing forward an interlocal agreement with the City of St. Petersburg, which will allow us to reimburse the city for their expenditures related to fish and debris cleanup in their canals and along their shorelines. With regard to what we know about other impacts, Visit St. Pete Clearwater. Again, we communicate with them twice a week. They get information from the hotels every Wednesday. And again, as everything you're hearing is that our hotels continue to have record reservations. There was a period of time where people were staying for shorter periods of time, but then there was somebody right behind them to take on that reservation. So there really did not appear to be any impacts there. The unknowns are some of our water-based businesses. We did have a significant number of complaints from kayak and those type of tours, the glass-bottom boats, the dolphin expeditions. All of those water-based businesses had impacts, as well as some of the vendors on the beach that rent out equipment. And then the question is, well, when will red tide end? And I can't give you an answer to that because we don't know. It's still out there. It can come back. Obviously, a few weeks ago, I said I was cautiously optimistic. The satellite imagery was looking good, and then it came back with a vengeance. So that's one thing we never know. This is red tide season right now. In 2018, red tide started on August 7th here, as far as impacts to Pinellas County. So we're kind of in that season. So we're going to be monitoring and keeping an eye on things that we're prepared to respond again if we need to do so. So I'm going to move on to Piney Point, and I know it's a little difficult to talk about the red tide without talking about Piney Point, so this piece of it's a little bit more integrated. But I did want to make sure, especially, that we get a lot of questions from the citizens about what is Piney Point. And so Piney Point, it is a former phosphate processing plant. It's over in Manatee County, and it's right on the lower part of Tampa Bay. It was originally built in 1966, so it's not a new facility, but it processed fertilizer for quite a long period of time until it was abandoned in 2001. And what the challenge here is that the phosphogypsum is a byproduct of the fertilizer process. The phosphogypsum is a radioactive waste, and that's what makes up the walls of those stacks out there. So you've got the phosphogypsum stacked, and then you've got a liner over top of that, and then you've got dirt and stabilizer and other things keeping that stack in place. And those stacks have obviously been holding millions of gallons of processed water together with rainwater, and in some cases dredge water, as the site was used for some dredging operations. From March 30th to April 9th, 2021, approximately 215 million gallons of wastewater from one of the stacks was released into Tampa Bay under an emergency order. This is not the first time it happened, and unfortunately, we've been seeing a lot of the negative environmental impacts that can occur from that type of event. So I showed this, this kind of layout back in April when the event was happening. The large water body there, right there, is called New Gypstack South, and that is the gypstack that had the tear in the liner. Normally, this would, the discharge for this site is a permitted stormwater discharge, and it discharges out into Bishop Harbor, which is a very environmentally sensitive area. It was impacted in 2011 when a spill occurred, and in order to protect Bishop Harbor, the Department of Environmental Protection approved an alternate discharge, sending it out through the port so that it was released into the main body of Tampa Bay where things could be better mixed or circulated. So this just is the same thing. It's a pull-out of that area, so you can see Piney Point and the discharge pathway in conjunction with our Pinellas County shoreline. And then on the right-hand side, this is where the University of South Florida actually developed a model to predict the impacts from the plume. The darker orange and yellow is where the discharges were the strongest and where it was coming out directly, and then as it gets lighter blue, it's more diluted. But you can still see that's from April 9th, and we were already, the plume was already predicted to be in our local waterways. And so the following month, we started to see some anomalies with regard to what you would normally see in our local coastal waters. And you can see in the middle there, that's the plume. That's May. It's a month later, and it's much more far-reaching. And at that point in time, we ended up with a blue-green algae bloom on Indian Rocks Beach and another blue-green algae bloom in Sarasota. These were very anomalous, not something we normally see. And we were seeing these populations of kind of nuisance algae growth in other areas as well, all kind of in and around that Piney Point area. And so this is a timeline provided by the Tampa Bay Estuary Program, and I just added a couple pieces that, down there in the left-hand corner was a satellite image. I showed you the April 9th plume, and you can see there in that satellite image that, a bloom was detected right there at that location. And so, what we've seen is, is it the match that lit the fire? That's the hard question to answer, but it definitely has significantly increased the amount of nitrogen entering Tampa Bay for this year. The amount of nitrogen that normally would come into this Bay segment is about the entire amount that Piney Point discharged. In a short period of time, the entire year's worth of nitrogen was dumped. So it's not unexpected that we would have significant impacts. And then that's a picture of one of the canals in Tierra Verde that we cleaned out. So what now? Well, obviously, since I submitted this presentation, there's been some changes. In speaking with the department about the closure and what happens next, they, now have filed a lawsuit against HRK, who is the owner of Piney Point, for failure to meet the requirements of a 2014 consent order that required them to address all the processed water on the property by 2019. Also, right now, again, water management is the most critical issue that we have. They are working on water management plans, which have to be submitted to DEP for review and approval. They are currently discharging stormwater out of the system over the next 4 to 5 days. It's about a million gallons a day that they're discharging right now. It does contain some ammonia. It is obviously much lower than processed water, but it still does contain some nutrients, and we're working with Manatee County and DEP to make sure that we're all staying on top of that. So we're also right now, the Florida Department of Environmental Protection is reviewing what's called a Class 1 underground injection control well. This is the proposed solution to addressing all the wastewater on the property and ultimately closing out the facility. One of my questions to them, and I thought you might want to know too, is, how did this happen so quickly? I mean, doing an underground injection well takes years and years and years of approvals and science and engineering, and how did we get here? So in 2014, Manatee County had actually submitted a permit application for an underground injection control well. Unfortunately, at that time, there was significant public opposition from the agricultural community in the area who was dependent on groundwater for irrigating their crops. So the Manatee County went ahead and withdrew that permit application and never moved it forward. So essentially what they're doing is it's the same permit application, it's the same data, and that's how they were able to move forward so quickly. If the permit is approved, well construction will take at least a year. They must drill test borings that demonstrate that they have a competent confining layer, which means that this industrial wastewater can't move laterally and it can't move vertically. As far as the closure design itself, that planning is in process. They're moving forward with geotechnical and engineering assessments as to how to properly close that facility once the wastewater has been disposed of. The stacks cannot impound water long term. That is a key component of the closure. So it does include the creation of some of the permitted stormwater facilities that will work more like a stormwater facility and not create the danger that a long-term impoundment does. And then I inquired about future uses, and the department said that they would anticipate those areas of the property that are not currently encumbered by the stacks or impacted by the stacks the future uses would be very similar to what's out there today, which is a lot of chemical processing, so it'd be heavy industrial, heavy commercial, those types of industries associated with the port that would need the port's services. And that is all I have.
Question? Yeah, Commissioner Justice.
Thank you, Mr. Chair. One, I want to add our thanks to DEP. I talked with some of our state legislators, and they had spoken with leadership there and were assured that we would have no problems and no issues about getting funding to take care of our costs. So I was very happy to hear that. Question I had was what the current status. I know you talked a lot about the closures and the stacks. My concern is what is the current water level now, and I mean where are they at as far as topping out with a storm on the way? What kind of urgent issues is the facility looking at?
Water management is their number one issue. I think it was last week, they got 4 inches of rain, and with every inch of rain, it's over 1 million gallons of water created on site. So it's a huge issue. That is why they were moving forward with a discharge. We had heard the potential that was going to happen last week, but they had to do some additional testing to make sure that the water met their permit discharge criteria. Keep in mind that the emergency order is no longer in place, so they cannot discharge out through the port. They must discharge. Their discharges have to be compliant with the permit that they have. So it is going into Bishop Harbor. It's not going into Tampa Bay. They did clean out what's called Basin 2, and that's kind of this. There's a series of ditches and like swales that convey water around the property to what's called Basin 2, and then Basin 2 discharges out. And they cleaned out Basin 2 and then did a bunch of monitoring to make sure that it complied with their permit, and then they started discharging. So they are currently discharging the storm water off the site to create more capacity. Additionally, they have 2 companies out there, Enclear and Phosphoree. These are two tech companies that are out there treating water from some of the stacks and treating and retreating that water. It's definitely does not appear to be an efficient process by my estimation of it. It's kind of, you just have to keep treating it over and over and over again to try to get a product that is safe for the environment. So it looks like it's going to take a while. But water management, I just want to be clear, this is not going to be over this year, next year, or even the next year. All right, this is going to take a long time to move that volume of water, if the injection well is approved, into an injection well. So the water management piece of that and preparing that site for storms and making sure that it's safe to the community who lives in the area and the environment, this is going to be a long-term process.
Thank you.
Commissioner Flowers?
Thank you. Thank you so much for a very thorough report, and thank you for asking the question that I think everybody wants to know or wanted to know, which was how was that deep injection well permitted so quickly, when we've heard that the city of St. Pete and other places have been applying to be able to put forth a deep well injection system and have been denied. Even though I know what deep well injection is supposed to do, I think in 2020 there was a earthquake that occurred 6 miles underneath the surface somewhere up in the Panhandle area. And I'm just sharing this for the record. I'm concerned that something like that could occur, which could potentially unsettle anything that occurs for deep well injection for the Piney Point location. I guess this is more for the public, because some of us, I think all of us, received a number of emails about what was the county, Pinellas County, what were we doing as it relates to Piney Point, when Piney Point actually exists over in Manatee County, but we are a part of a regional approach as it relates to how we can clean up these environmental issues and working together on that. So I'm glad for the update, and hopefully those that are listening or tuning in who've been on earlier will share this information with their groups of people. On a positive note, Mayor Johnson, Al Johnson from St. Pete Beach, was at the Mayor's Council meeting last week that I attended, and he asked me to please pass along a personal, huge thank you. He said Pinellas County government was absolutely wonderful in helping with the red tide issues and the cleanup in the St. Pete Beach area. So please pass that along to any of your team members, that the hard work that you guys put forth was definitely appreciated. The last thing, or the question that I have, is for Piney Point and any work going forward. In between that time, we have 2 storms coming up now. So in between that time, have they talked about any potential measures or messaging that could get out to the community? For the one storm, they're calling it a cyclone potentially. So that, and the direction it is coming, it could destabilize some things in that area. Have you guys had any conversation about messaging along those lines? And I know you can't pinpoint exactly what will or will not happen, but any thoughts about if that's going to make our situation worse down there? Or?
Well, again, the one thing that we know is that with every inch out there, over 1 million gallons is produced on that site, and obviously that's a huge concern. I did see some pictures of the stack last week from my colleagues who were out there, and it's not, that south stack is not completely full. And you can still readily see the repair area. It's easy to visualize, and it's in place, and they're monitoring it daily. I did note that the Department of Environmental Protection started putting out their daily update again, starting last week. That was something we talked about, is that, they just kind of stopped, and then that always generates questions. It's like, why are we not hearing about this anymore? We know it didn't go away. So I'm glad that they did that. I can definitely inquire as to, what the plan is as far as storms. I'm sure it's something that has to be a part of their water management plan that will be submitted to the department. But when I asked them to give me their number one, their number two, their number three priority issues, water management was number one.
Commissioner Long?
Thank you, Kelly, and thank you once again for just being here and being who you are. I have a couple things that I would really like you to think about, and then we can talk later off. Number one, do you think, or is it possible that we could include an item in our upcoming legislative package for our legislators to take action on behalf of Pinellas County, so that this kind of thing doesn't happen again? And number two, I remember right after the Piney Point incident happened, we had a Tampa Bay Regional Planning Council meeting, and I asked the question if there was any data that showed us within Tampa Bay how many other types of facilities like this there are. And I can remember just being stunned when our representative from Manatee County said, "Oh, Commissioner Long, there are dozens of them." So then I asked a follow-up, well, can we please get a list of where they are and what the condition of them is? And I have never, ever gotten that. And I'm curious about whether or not you have it, or if you know of other types of facilities that are like this within Tampa Bay.
There is, I can definitely provide that information. There's a map online that kind of shows where they are. As far as other facilities like Piney Point, I believe Piney Point is kind of unique in that the other facilities are being actively mined. They're actually active phosphate mining operations, where Piney Point is not. So I believe Piney Point is the only one that it's in this state that it's in right now. So I'm not aware of any others.
Well, it's very troubling to hear you say that while I know about the phosphate mining facilities. My question was more specific to if there are any of them that are approaching the condition of Piney Point. And the reason I ask that, because it is not a secret that the elected folks in Manatee knew about this bubbling crisis for over 20 years, and they did nothing to take care of it. So what is deeply troubling to me is Tampa Bay doesn't just belong to Manatee County. It belongs to all of us that surround the bay. And it is just a terrific tragedy that this kind of thing continues to impact the bay. I mean, it's not just the Piney Point, it's the, way the cities have offloaded their stuff into the bay. The story goes on. There must be some better way that we can get a handle on this that doesn't take years and years and years and years of nonsense to get us nowhere.
I will get you the information on all the other facilities in the Tampa Bay watershed, so that you have that, so that you all have that. We have a regional partnership and with working with the Tampa Bay Estuary Program through what's called the Nitrogen Management Consortium. Back in the mid 2000s, we were notified that there was an EPA total maximum daily load that had been finalized that I guess folks were not aware of, and a permit came in for renewal that triggered that TMDL, and they advised us that we were non-compliant. At that point in time, you know, it took over 100 of us coming together every Friday for months. I think it was like 7 to 9 months, every single Friday for a 10 to 12-hour day, working on a plan to ensure that we met the regulatory requirements with regard to the discharges of nitrogen into the bay from all sources, whether it be stormwater or reclaimed water or mining water. TECO, Duke are all at the table, Tropicana. Every private, public entity that has a permit that impacts Tampa Bay, we came together to develop this this plan on how we were going to achieve, you know, that restoration goal. It was a huge effort. It was a huge accomplishment for the region because it was all voluntary. I mean, yes, we had this TMDL that we all had to deal with, but we came together voluntarily and to build the plan and take a path forward. And that ultimately led to us hitting a restoration target for Tampa Bay that I don't know that I was expecting to see in my career. I kind of thought, you know, yeah, we'll hit that seagrass target, but I'm going to be retired and I'll still celebrate it, but, you know, I probably won't be here when that happens. And so when it happened sooner rather than later, that was just, it was just amazing. And so now, so you're aware, we're not there anymore. We've already lost seagrasses, and we're now below that target, and we're going to be below that target again with this event. So, and that's exactly what happened over in the Indian River Lagoon, and we don't want that to happen here. Indian River Lagoon was trending beautifully with their restoration. They hit a tipping point, and now they've lost tremendous amounts of seagrass in their area, and you're hearing about all the manatees that are starving to death because of that. You know, we could go down that same pathway if we're not careful. And so, if anything, that is my message, is that, you know, we're approaching a tipping point now where we are losing seagrass acreage. We've had a tremendous impact to the bay, a significant impact to the resource, and it sure takes a whole lot more work to get it back than it does an event to lose it. So we've really got to get ourselves back on track.
So, if I could follow up, Mr. Chair. So recently, I have been approached by several folks who seem to think that they have a solution for helping us with seagrass. I don't know what the right word to use is, but my question would be, is there a plan to get back to where we were at least, and how quickly we can do that?
And our experience has been, you improve the water quality, the seagrasses come back on their own. And it's the prevention versus cure strategy. It's, when you look at, I think the estuary program estimated that, you know, from 2017 to current, I think we're at $2.5 billion of investments in water quality and restoration in Tampa Bay. It's been a huge, you know, amount of money invested in achieving, you know, the targets. So really what we need to get back to is cleaning up our water, you know, and we can do it. I mean, we've done it before. We can do it again, but, you know, we can't take our eye off the mark there.
Well, I know I hear you say that, and with all due respect, I also heard you say this is not going to get resolved this year or next year or the following year. And to me, that's already too much time.
Yeah.
I mean, and I guess that's what I'm asking you to think about, is how do we do that faster and in a more, I don't know, productive way?
Yeah. Well, definitely put on my thinking cap, but I will still go back and say, you know, that, you know, Piney Point was an event. It was a horrible event, and I wish it didn't happen. I think we all wish it didn't happen. But every single day, there are sources of pollution into our local waters that we do have control over. And those are, those are a lot of the efforts that we're putting forth, because if, I go back to, if every single person in Pinellas County and Hillsborough County, I mean, that's over 3.5 million people in the greater Tampa Bay area, did a couple little things different, the amount of impact, positive impact on Tampa Bay would be tremendous, notwithstanding regulatory challenges of dealing with some of these plants that need to occur. We do have a lot of power, and I just hope that we have it in ourselves to do it.
So then I have one last point, if I might, Mr. Chair. Since you're standing there and you are kind of the solution to how we fix that problem, what's the status of the issue with the horseback riding down around the bridge and over on the Manatee side? I'm sorry, I couldn't help but ask.
There's no horseback riding going on in our local waterways, but there is horseback riding going on in Palmasola. So they are still riding in Palmasola, and of course, there's a lot of trails and a lot of the other activities going on. I see a lot of the advertisements for a lot of the opportunities going on.
Thank you.
Kelly, the group that you had put together to deal with the issues in Tampa Bay, I guess before, is that still together, that group?
Oh, yes, the Tampa Bay Nitrogen Management Consortium is still together. We are forever bound by the reasonable assurance document, and we have to update that on a 5-year schedule. We have regular meetings. We go over progress. We go over where we're falling backwards and what we can do together. It is facilitated by the estuary program with a technical contractor on staff to help us with all of our regulatory reporting requirements. But yep, we're all still at the table, and we're all still doing the hard work.
So even before Piney Point, we were falling back a little bit, you said?
Correct. Okay. Yep. The most recent, the Seagrass aerials that the Southwest Florida Water Management District flew showed a significant decline. It may have to do with, one, we had the 2018 red tide, and we knew that there were seagrass impacts as a result of that. We also have the long duration algae blooms going up in the old Tampa Bay north of the bridges that has been persistent, and it's causing issues up with seagrasses in that area.
And then last thing for me is you had said the reimbursement side was close to $1 million. I understand when the governor was here that they had committed to the $2 million. That's not an issue then, right?
No, the interim secretary of the Department of Environmental Protection has advised that they have the funding available to cover all of our cleanup needs.
Okay, great. Commissioner Justice, did you?
Yeah, thank you. The improvements that we saw in seagrass and water quality were, I think, universally agreed that it was directly attributed to the reduction of nitrogen discharge, and a lot of that from personal properties and fertilizers. Commissions long before us in Pinellas put in the fertilizer ordinance. Those of us that were in Tallahassee had to fight off preemption and keep it grandfathered as they've done changes. But really, I think an area, Commissioner Long, is as you talk to friends at DOT and they're designing the new Howard Franklin to incorporate design to where it doesn't impede but actually enhances tidal flow in the north part of our bay is critical, because that's where we're seeing a lot of the, still seeing some of that runoff, the peridynium and some of the other things that impacts the quality of water up there.
Mr. Chair, what is the name of that group you just kept making reference to? David referenced it as
The Nitrogen Management Consortium.
Nitrogen
Yeah.
management. Okay, thank you.
And Commissioner Justice is absolutely correct. We.
No, please elaborate. No, kidding. But I'm sure that we've given that input to DOT. I mean, I know that's hopefully been taken into account. It's
We
better
have
now than
yeah.
later.
Yeah, we have, and fortunately, it's not moving forward, but we have.
Could you, maybe you can talk to me later about what it isn't moving forward? I'd like to hear about that. Okay. Anything else for Kelly? Okay. Barry, anything else?
Yes, we also have Aubrey Phillips here, who's going to, you had asked for an update regarding our emergency rental assistance program.
Thank you, Commissioners. So we'll just share a brief update today, and joining me will be Carol Strickland from Housing and Community Development. For the record, my name is Aubrey Phillips. I'm with the Pinellas County Office of Management and Budget. So last year, as you remember, Commissioners, Pinellas County worked with community partners to mobilize federal CARES dollars and provide $24.6 million in financial assistance to households for rent, mortgage, and utilities. Through COVID-19. Through those programs, we were able to help about 8,500 households throughout Pinellas County. Building on those partnerships and the lessons learned from that experience, we've partnered with the City of St. Petersburg to launch emergency rental assistance, and that is countywide through the Federal Emergency Rental Assistance Program. With operational leadership from Housing and Community Development, the program has currently spent out about just over 15% of all of the rental assistance funds that were allocated to Pinellas County. That's exceeding the national average of about 10%, and Carol's going to share more with us about the program that is available now and how renters and landlords can access these assistance resources.
Good afternoon, Commissioners. Carol Strickland, Director of Housing and Community Development. I'm really pleased to be able to report that we launched this program on March 31st of this year. And as of August 5th, as you've seen in your weekly reports, we've assisted 1,019 individuals with rental assistance. And that equates to $7.2 million in rental assistance. And our average payout is around $7,100 per applicant. This program is available to low-income households who are at risk of housing instability and have either lost their jobs due to COVID-related impacts or had a significant reduction in income. So low-income individuals, those are individuals or households that are at or below 80% of the median income. And for example, for an individual, that would equate to around $41,350 a year, or for a four-person household, it would be $59,050 a year. These applications can be initiated either by an individual or a landlord. In most cases, the rental assistance is provided directly to the landlord, although there are provisions to have payout directly to individuals. I think our big message today, of course, is how can individuals who are behind on their rent access this program. And we have a slide up. We do have a dedicated URL. It's pinellas.gov/ERAP, E-R-A-P, and all of the resources that are needed for individuals to access the application form, and our frequently asked questions pages there that would give both renters and landlords all the information that they need to apply. We also do have a call center that's operated by our vendor, and that phone number for assistance is 855-379-3515. And with that, I'll stop there, and Aubrey and I are available to answer any questions you may have about this program.
Yeah, I had a question for you real quick. So when the landlords apply on behalf of tenants, I'm assuming, that are behind in their rent, and they're paid, does that clear back rent for the tenant that's there that would stop any proceedings by the landlord for eviction?
That is the intent of the program. Back rent back into March of 20 can be paid, and we're able to also pay rent ahead once those arrears are caught up. But essentially, we do triage applicants so that if there are issues of eviction, we focus on those cases. And we also are working with our community partners to provide legal assistance to those facing eviction as we get caught up with the rent.
So I was looking at your average payout was $7,100. So obviously that does mean some multiple months, I'm guessing.
That's
right?
typically a 3-month payout.
So 3 or 4 months. And are we finding out that when that is paid, that it is caught up? Or are we paying it and there's not caught up and they're still going through eviction? I mean, I'm just trying to get an understanding between the correlation of getting caught up and eviction. So where are we? What role do we play in that?
We're able to fully pay the arrears. The only caveat there is the maximum amount under our current program is 12 months. I don't know that we have statistics regarding whether people have gotten the rental assistance and still faced eviction. I'm not sure we're able to track that.
Yeah, we don't have the individual status in terms of if they have an eviction case proceeding tracked as part of the application. But the program, the way it's set up is any past due rent that the tenant owes is paid first before any future months are paid, so that it settles that past due debt that they owe to their landlord. The landlord's made whole. Now, that doesn't impact if there are eviction proceedings for other reasons other than past due rent.
And then the last question I had is, so folks that are unemployed, are we pivoting in assistance to try to get them help finding work? I mean, there's plenty of opportunities out there, and I'm not saying that one should lead to the other, but certainly if we pay the back rent and help them through employment opportunities, not us providing the job, but there are opportunities out there. Are we able to help in that regard? Or have we been able to help in that regard? Or should we be helping in that regard? I think we should, but.
So the scope of this program, Emergency Rental Assistance, is focused primarily on delivering the rental assistance. But I think the question you ask is a really good one, and one we've been having a lot of conversation with with community partners as well as with Human Services, is making sure that those renters who are coming through this program are being able to get connected with case management services so that ultimately they are able to get their feet back under them and be self-sustaining on their rent moving forward.
I mean, I think that's really important. If families that are going through this, individuals that are going through this are having issues, obviously, for some reason or another, and, you know, life is passing fast. And so our ability to help out, that's why I love the Habitat for Humanity, a hand up, you know, it's really important to try to do what we can to pivot them into that process. So I'm hoping that at least, again, I'm not trying to say you have to have a job to get the payback. I'm just saying I think it's important that we provide that outlet. So enough said on that. Thank you. Any other comment? Yes, Commissioner Gerard.
Yeah, I'd asked for this little report, and now I can't find your report that you send out every week. Sorry. I might have to call you and just have you walk me through it because the numbers don't make sense to me. It looks like we still have a lot of applications that are just floating around out there waiting for information or haven't been processed yet, or what kind of issues are we still having?
So one of the ways that we've been working together between Housing and Community Development and OMB is they bring the operational expertise of running housing programs. We bring the data and analytics expertise and help with that side of things. There are a number of applications that are in the system. Someone's gone in and started an application and then never gone through and completed it. One of the ways that we're addressing that is by engaging JWB and their Family Services Initiative staff are actually following up with applicants that have pending information. We're starting with that population and then going to those who haven't yet submitted their application. One of the things that we've seen with a few applicants that we've spoken to and heard from other communities around the country is that applicants are often self-selecting out. They get so far in the application, get intimidated or overwhelmed, and self-select out. So doing that personal follow-up seems to be really effective, and that's just getting going now. So we're really excited to have JWB on board helping with that.
Yeah, that would be helpful to get those cleared out. Okay, thanks.
Thank you. Thank you for the report that we did receive for the update for today that was sent prior to our meeting. I had some of the same concerns as Commissioner Gerard, because when I looked at the total intake number of applications submitted, and it has 374. And then when you, well, it didn't say total, it just says intake, I'm sorry. And then when you look at the total there, it's 374, but when you go further down into just Pinellas County, I'm not talking about St. Pete because they do their own, they have their own program. But when you go down into Pinellas County, our numbers there are greater. So I don't know if those two numbers should be combined. It just says figures include applications for both Pinellas County and the city of St. Petersburg for that 374. But then when you look at what Pinellas County has, and if you add St. Pete, it's a larger number. So I don't know if you mean maybe for that month? Is that?
That's at the time that the data is reported. It's how many are in a submission status as of the time of that report being pulled. So over time, after they're submitted, we review them and they'll show up in other areas of the report. So it's a point in time capture of how many have been submitted but not yet reviewed.
Okay, thank you for that clarity. And then I'm glad to see the average days of applications that have been submitted but are waiting to be reviewed. I'm glad to see that that number's getting lower because that shows that we're trying to move through the process. And I will say this, because I know I sent an email, and it's because I know we have our persons out in the community working, but we still have people who submit and they get frustrated and then they contact a commissioner or somebody who they think can help them. But I will tell you, one of the things I've run across, and it's sad, this is not all landlords, but they know that that person is working through this process. They're being updated about the process. The landlord's going to get the money if they qualify, but the landlord's not giving you guys what they need to give you. And so persons are stuck because this process is very different from the previous process where you could get those affidavits, if you will. And so that's why I'm consistently saying, where are we? What does this person need? Because this is what's going on or what's happening. The other wish that I had, because you are right, some people get frustrated and intimidated because they are not comfortable with applying online, which was why when I called some months ago with a concern from Doug Cooley about whether or not there was another way for persons to apply, because some persons are intimidated by that process, or they have to go to one of the community support centers to have that help. And I do know of some people who've actually been going out to persons' home, and they work with JWB, you know who I'm talking about, but they go out there just to try to help walk them through the process. They take a laptop with them and try to help them get through the process. So I'm not saying the way that we're doing it is wrong. It is just that I believe sometimes we create an additional barrier in trying to be efficient, I guess is what I'm trying to say. So when I'm asking you for stuff, don't take it like I'm on you, but it's just that I see what's going on from the person sharing with me. I know you can't do anything about some of the landlords who just don't send or give the person what they need to give you. And I know that the organization that's doing this for us can't move forward with certain things until they get all the documentation that they need. And the other reason why I'm going through this is because, you know, you see the headlines, X amount of dollars have been provided for rental assistance. Only 2% of those dollars have been used. What's going on? Why aren't those dollars being pushed out? So that's why I'm sharing what I'm sharing with you guys right now. So I'm just hopeful that we can, especially with the JWB family support staff going out, I'm hopeful that we can kind of push some of these things along, because the ones that we have here that are waiting, you know, that have information that's outstanding, that's a good number of people. And fortunately, there was a little stay because, you know, the eviction moratorium was supposed to go away, and then they got a little reprieve, but that's not going to keep happening. And so, but thank you for the work that you're doing. I know it's difficult, but that's why I kind of keep calling or emailing saying, where are we with these people, because it is difficult. Thank you. Thank you, Ms. Carroll.
Commissioner, thank you very much for bringing up the assistance that's available out in the community for applicants. We also have access to the applications available at some of our libraries and through some of our community partners, but that is a concern, and as we listen to the Treasury that's talking about best practices, that is an acknowledged barrier and something we're looking at is access to that application. With regard to the landlords, we do in our policies and procedures have a process whereby we can make payment directly to tenants if we've contacted the landlord and if they decline to participate. If the applicant is otherwise qualified, we are able to make payment directly to tenants. Another thing I wanted to mention in response to the chair's question about eviction is we have created a process called letter of intent. So if for some reason a tenant that's applied for our assistance is in the position of having to move for whatever reason, expiration of a lease, non-renewal, or eviction, we're able to pay the arrears in their existing home and then provide them with what's called a letter of intent that they can take out in the marketplace and show to prospective landlords and say, I have approval for 3 months of rent to assist me in making this transition. So we're mindful of people that may have needs for housing beyond their current dwelling.
Anybody else? Getting back to the comment that I made a little bit ago on the job front, because some of these folks clearly have gone through a tough time, or some folks have mentioned that have a difficult time, or it's confusing or whatever, or uncomfortable going through the process of asking for those back rent. But I think at the same time, there's probably some, not all, because some are out there looking for jobs on their own. But there's, in some cases, just, need some help and assistance. So I'm just going to say it again. I think that's something that we should be providing for folks so that if they are having a tough time figuring out how to access the market. There seems to be a lot of people looking for work, and there seems to be a lot of people looking for applicants. So somehow there's a disconnect out there, and I don't know what it is. I'm not smart enough to know that, but there is a disconnect going on, and I think whatever we can do to point folks, and they don't have to take it. I'm just saying I think it's probably really important and probably one of the things that we can do. We have those outlets, and we need to do what we can to help. So just saying it again. All right. Anybody else for these folks, these fine folks? Thank you all. Appreciate the update. Barry?
That's all I got.
Okay. Let's go back to Ms. Catt. What do we have?
So we did not select another redistricting board member on the last round. However, I do have a new round of ballots. I have eliminated the one individual who did not receive any votes.
Okay. So how many folks do we have left?
We have 5 individuals left.
And did we get, could you tell me what was the vote count? I'm just trying to get a sense of, again.
Sure. So Molly Ald received 1 vote. Caitlin Constantine received 1 vote. Bruce Livingston received 3 votes. Karen Mullins received 1 vote. And Andrew Wilson received 1 vote on the last ballot.
Okay. So we're going to do it again with 1 less person on the ballot. Okay. At some point, we may have to change our approach, but just go ahead. I kept hoping that we'd get somebody with a second amount so we could at least narrow it to 2 people. So if everybody would just vote like I did, then, no, I'm kidding. No, I'm kidding. All right. We're voting again, Commissioner. We're voting one more time. We had 1 person with 3 and 4 people with 1. Yeah. So we had 4 people with 1, 1 person with 3, and we're dropping 1 person off the ballot. So. And everybody agreed that they would vote just like I did, so that's. While you were gone, we made. Kidding. All right. Okay, so while that work is being done, our supervisor of elections over there, thank you, Kat. Julie Marcus has nothing on you. Kidding, Julie. All right, we're going to move on to item 26, which is the appointment of Historic Preservation Board for Commissioner Justice's appointee, and he would like to have Ms. Velarde. Would you make that motion, or?
Move approval of Rachel Velarde appointment to the Historic Preservation Board.
And a second by Commissioner Peters. All in favor, say aye.
Aye.
Any opposed? Motion carries unanimously. Item 27 is the one we are on, and so we continue in that effort to gain our last appointee. And we will move on to item 28, which is appointment to the Pinellas County Housing Finance Authority. And we have 3 applicants there, right? And you have a ballot for that, too? Okay.
Yes, Mr. Chair, I do have a ballot for that.
Yes, Commissioner Flowers.
Of those 3 names, I think this is the same one. 2 of them have only been residents of Pinellas County for 1 year, and the other
1 month.
1 month. I'm sorry, 1 month. Thank you. I knew it was a 1. And 1 since 2019.
Correct.
So is there a
minimum
residency?
time?
Yeah.
Well,
One of the persons used to live here, moved away, came
there's
back.
not a, is there a, go ahead. Maybe,
Thank you for correcting me on the month and year.
was that?
Thank you for correcting me on the month and year.
Yeah.
I knew it was.
It wasn't law.
Hi. One of the candidates had lived here for a while, moved away, and has moved back, and that was Christina Kovaric, who is in Dunedin. She was born and raised here. So, but she has just been back for 9 months.
Okay.
That's correct.
Okay. Okay, so.
Thank you.
You have the ballot. You can pass that around.
Thank you.
Getting really good.
Yes, yes.
Jewel, I'm impressed, our supervisor of elections 2 here. There wasn't any, David Waddell wasn't online, was he, for this? He talked earlier. He wasn't back on.
Let me check to see
Okay.
if he's there.
Is he? All right. So we will take that call. Go ahead.
Okay. Mr. Waddell, I know you had wanted to speak on this item, so we're going to unmute you here. And you'll have 3 minutes, sir.
Yes, once again, good afternoon. David Waddell, 4835 164th Avenue North, Clearwater, Florida, 33762. Well, over 15 years, I've been accused of being a conspiracy theorist, and this is near and dear to my heart with the Housing Finance Authority. I've been working with and observing, and I've read the 3 candidates, and what we've got is a problem with standard operating procedure, and government officials are held to a higher standard, and of course character. Proper vetting is clearly important, which, well, we can see with what's occurred in the past with Chaff and with Bright Communities. I think we need to have a reorg of the Housing Finance Authority across the board. what disturbs me is these uncollectibles. And through the years, I've seen loan and mortgage modifications and forgiveness. And for the life of me, I can't understand how we end up with uncollectibles and we're giving away state and federal dollars. I mean, we've already got Sadowski being pillaged every year. But this fella with the background in working with HUD regarding fraud, I think he's our guy. If there was ever a time, and the Lord works in mysterious ways, and I know you all know what I'm talking about, what's been occurring here in the last 15 years with a two highly ranking officials in conflict of interest. And we will get to the bottom of this. And Barry, I expect your full cooperation on this because this is going to be your time to shine, my friend. You got 3,000 people to be responsible for. We've got retired employees that I've taken witness statements from, and so have others, and current employees that are looking at what's going on down there. And I'm going to tell you, the feedback's not good. If I know of it and you don't, that's a big problem. So I'd like to give my vote to Mr. Michael Wicks. He's our guy, and we got to reorganize our Housing Finance Authority. I'm done, and you're telling me you got problems with staff and money?
David, thank you. Appreciate it.
Okay, thank you.
Mr. Chair.
Thank you very much.
Just for the record, since we did have a citizen comment, Kat already has your ballots. Does anybody wish to change their vote based upon the citizen comment? I'm not seeing any yeses, so she'll go ahead and tally those up.
Okay. While she's tallying, I guess, two sets of votes, right? We'll go on to item 29, which is really County Commission new business. Anything that you'd like to bring up at this time? I just wanted to say a couple things. First of all, the items of interest requests that I made for you guys, try your best to get them in by the end of the week. I have heard from a couple of you, and I've got mine in as well. So by the end of the week, and then we can plan out a couple of workshops accordingly. So we're going to try to do the first one in September and a second one in October. So that's the only thing I wanted to bring up at this. I'll bring up one other thing in a little bit. Commissioner Flowers?
Thank you, Mr. Chair. I just wanted to give a little update regarding what happened with TBARTA and PSTA at this time. Many of you know that we've been having a little difficulty getting a quorum for TBARTA in order to make some things happen, but we actually had a quorum at our last meeting and were able to get a couple of things through that help with transportation modalities for our county. The first is that there were 4 different renditions of the Regional Rapid Transit Feasibility Study that we wanted to do that would link at either buses on shoulders or buses in dedicated lanes to move people expeditiously within the region. And so we were able to finally vote on something, and what we selected was 8C that allows for dedicated lanes instead of on shoulder, and it would cover from St. Petersburg going up through Hillsborough County, coming over to Pasco County, and from Bears Avenue on into Pasco County, paying for that additional stretch, which added about $30 million to the project, but that was what was voted upon. So I'm happy, and I'm sure my colleague over there is happy too, that we finally were able to take a vote on something. The budget for TBARTA is extremely strong with a clean audit for the end of the year. So we were happy about that, and also happy about regional mobility on demand program, so that once you catch transportation to one specific location, there will be an app that you could use. So if you needed to have an Uber pick you up, or any other type of transportation to get you to the destination where you need to go, there will be specific places designated for that. So we were excited about that and moving that one forward. Staff will be working on that. Palm Tran in Glades has something very similar, and it's working really, really well. I know a lot of people complain about public transportation because it doesn't get them where they need to go on time. And so this will help alleviate that. So we were finally able to do some things through TBAR. The new officers were elected. Cliff Manuel Jr. is the chair. Catherine Starkey is the vice chair, and I was elected as secretary treasurer for TBARTA. For PSTA, Sunrunner is up and going. If you come into St. Pete, you go down First Avenue, north to south, you see these big, huge things on the side that look really weird, but they're actually the intermodal stations for the Sunrunner to go through. So those are moving expeditiously. I am glad to see that PSTA did not get the type of attendance that they wanted in community meetings to talk about expanding transportation modalities. So they held some additional community conversations in communities of color, and there were over 16 organizations that came and were able to provide their input as it relates to how important transportation is, where should some of the transportation lifts go, or transfer stations and things of that nature. So I was very glad to see that staff followed through on that and came up with some really good ideas. We talk all the time about the utilization of DBE programs. And so for the Sunrunner, there's a 12.44% DBE participation within that program, and so that's up from PSTA's general benchmark of 7.7%. So helping those minority vendors become actually vendors working on those projects, I think is really good for our community. And those are the meat and potatoes of it. Long meetings, but those are the meat and potatoes of what
Thank
happened.
you. Thank you, Commissioner Flowers, and congratulations on the appointment.
Yeah, I don't get the keys to the bank or the checkbook, but it's okay. Thank you, sir. Thank you for allowing me
Anybody
the
else?
time.
Commissioner Seal?
Well, I was not present at the Forward Pinellas meeting, but apparently the board adopted the Advantage Pinellas Housing Compact, which is working on affordable housing solutions. And you reviewed the executive director annual performance, and by a 9-1 vote with Commissioner Eggers declining, did a pay increase of 3.5% for the executive director. And those are probably, the budget was passed unanimously, which then came on to us, and it maintained the current millage rate. Thank you.
Yes, Commissioner Long.
Did you have something, Pat? I think it's also important to let everyone know that the Forward Pinellas Legislative Workshop is being held tomorrow at Ruth Eckerd Hall at 10 o'clock or 11, 10:30.
10:30 to noon.
10:30 to noon, yeah.
Yeah. Did you have, anybody else have anything?
I have more.
Oh, go ahead.
Okay, thank you. Okay. Besides the Forward Pinellas Legislative Workshop, I was a little bit surprised, and maybe you could all give it some thought, that we have introduced another Tampa Bay Transit Alliance Committee. And one of the issues, it's problematic when we keep adding new agencies. This particular group has no authority, no funding revenue, and quite frankly, it muddies the waters in terms of messaging about what we're all trying to do with transportation, and especially when you're trying to apply for federal funds. One of the caveats that they always ask is, are you speaking as one voice with one message for the entire region? And you know, we all know that we had some issues with T-BARTA this last go-around in the legislature because one of our local senators doesn't like the agency and thinks we have too many transportation groups working on this subject matter. And so I don't know how the rest of you feel, but I'm a little surprised at that. And I'm still struggling to figure out what it is that, or why it is that we needed to create another transportation group. So give that some thought, more to come on that. The other couple of things that I had that I want to share is the Regional Planning Council meeting this month was really, really, really interesting as it related to several of the things. We did have a report on the red tide in the Tampa Bay region, and there was another presentation made about the new aviation cluster studies that are going on, and I don't remember the gentleman that was speaking, but he went on to talk about all the different entities that we have in Tampa Bay that could be, Kevin might be interested in this, because one of the things he talked about were all of the opportunities for industry and economic development and manufacturing and defense. And it was interesting to hear the way he spoke about it in terms of studying that issue for all of Tampa Bay. And then you all know, I think, that in January, we are planning, and we are still hopeful that we'll be able to do it in person, a 2-day climate change and sea level rise summit. In April, we're planning on bringing back the Future of the Regions Award, which I know some of you have attended in the past. And in May, the Housing Summit. So stay tuned for more of that to come. We did have a presentation, I believe it was from Ed Sherwood from the Estuary Group, that talked about the Tampa Bay seagrass problem. And there was another presentation made about shorelines and seawalls and how we add that into our discussion with regard to appropriating federal grants. So I guess that's the end of my report, Mr. Chair. Thank you.
Yeah, I had a couple little things. It's my understanding, Commissioner Long, that the new entity is really the MPO Chairs Coordinating Committee. They just changed their name. It's not a new group.
It's not a new group, but the point is it's got a new name, and they are not doing, I don't think they're doing the same thing that COC or whatever that thing was called, that was a subcategory of T-BARTA. They're not doing the same thing. I don't think.
TMA.
I could be wrong.
Yeah, the TMA is obviously just a 3-county
Right.
group. The CCC group, or the new name, is the 8-county Transportation Coordinating Committee. So it's a larger piece, and its primary focus is transportation, roads, that kind of thing.
And I don't think that's a bad thing. I think, you know, if the MPOs from 8 different counties are getting together to talk about what their priorities are, I think that's a good thing. They've been asking us to do that for a long time. And I'm glad that they're going to continue doing that. I'm not sure what the name change was about, but.
Well, I think, TMA, CCC, now this new group name,
Yeah.
they're all, primary function is transportation, roads, bridges, and that kind of thing. They're all dabbling in, because of the people that are at the table, board members at the table, talking about transit as well as part of the overall system. So, I mean, I think the more people talk about it, it's not necessarily conflicting with T-BARTA, or at least I don't see.
Right. No, I think we're actually getting somewhere with all of those groups. Anyway, I wanted to add to the PSGA that we have adopted our Flamingo cards for riders, and encouraging to the point of not charging them anything for the next month or so, everyone to get one of these cards that they can carry on board and not have to carry cash and therefore PSTA doesn't have to deal with the cash and all that. And it's also good for rides in Hillsborough County as well. And it helps implement what we did last month, which was to cap fares, cap monthly fares that somebody would be spending, so that it easily does that electronically rather than having the person have to do that for themselves. And they can be gotten at all PSTA stations, and soon, I don't think we have it yet, but at many places like Walgreens and wherever they sell gift cards.
Anybody else? All right, I just had a couple things. One, I was interested in what Commissioner Flowers was talking about on the on-demand deal. I'm talking to more and more young people about, because we keep hearing that young people want transit alternatives. And so I, trying to talk to more of them, and that's one market. We have a need-based market too that needs to be able to get to work and get around because they don't have automobiles. And their comment was this on-demand thing, without regard to maybe even being on a bus, but having the ability to just on-demand service so that they can get from where they are to where they are on a timely basis. Because until obviously a system is more robust, with more headways and more frequencies and that kind of thing, or less headways and more frequency, that is still going to be a problem. And people getting around alternatively from their own vehicle is going to be minimal opportunity. So many of them were talking about that on demand, but in maybe a little different way, but just as a side note. Tampa Bay Water, we meet on August 31st. Our board will be interviewing 5 to 6 employees or applicants for the general manager or the top position at Tampa Bay Water. I'm going to be sending out what we get on those applicants to our utility folks who are very intimately involved in Tampa Bay Water, work with their staff, work with the general manager and all of that. So I want to get their input as well before I go and talk and put my input on who I think should be. We have one internal candidate and 4 or 5 external candidates. So I'm hoping that we have some good folks there. I'm told we do, and we'll see how that it turns out. And then that's really all I had. So if I don't see anybody else with anything, we are adjourned. Up. Oh, that's right. Never mind. Everybody's waiting on pins and needles. We've got 2 ballots. My apologies. Gosh.
Thank you, Mr. Chair.
Yeah.
So I'm going to start with the ballot for the Housing Finance Authority. This was agenda item number 28, and by majority vote, the commission by ballot vote voted for Christina Kovaric for that. For the redistricting board, I'm happy to report after round 4 of the ballots, we do have our 4 now selected members of the redistricting board. On this final ballot, the board did choose Bruce Livingston to be on the board. So the full 4 members, I'm just going to list them out loud for the record, is Bruce Livingston, Brian Angst, Angst.
Yeah.
Thank you. I appreciate that. Johnny Boykins and Karen Owen.
And then the original 7 that I mentioned earlier. So that's the group.
And Mr. Chair, you do need to take a vote on
Yeah,
the
that's
7.
what I was going to do. Thank you.
Of Mr. Livingston, Mr. Unks, Mr. Boykins, and Ms. Mullins.
And the original,
And the original
7.
7 as recommended by each commissioner.
Correction on the names, though.
It was Karen Owen was the one. who
Owen,
was-
I'm sorry. I'm sorry. Thank you.
Okay, so I have a motion
Owens.
and a second by Commissioner Gerard.
Nice try, though.
Okay.
I thought I heard.
All right. All in favor, say aye.
Aye.
Any opposed? Okay, motion carries. We now have our redistricting board that will start meeting this month with the consultant and an attorney and a clerk's office appointee. Anything else before I try to adjourn again? All right. Okay. We are then adjourned. Thank you.